Chapter 1, Introduction to Fanconi Anemia. Fanconi anemia, FA, is a rare inherited disorder that primarily affects the bone marrow, leading to a condition known as aplastic anemia. Individuals with FA often experience a progressive failure of blood cell production, resulting in a range of serious health issues such as bleeding, infections, and fatigue. FA is also linked to a heightened risk of certain cancers, especially leukemia. This genetic disorder is caused by mutations in any of several genes that are involved in the repair of DNA damage. These mutations compromise the body's ability to fix chromosomal damage, which leads to instability and a predisposition to various forms of cancer. The history of Fanconi anemia dates back to the early 20th century, when Swiss pediatrician Guido Fanconi first described the condition. Though it was initially understood only as a form of anemia, further research has revealed the complexities of its genetic underpinnings and broader clinical manifestations. Today, scientists and medical professionals recognize FA as a complex, multi-system disorder that affects not only blood cells, but also organs such as the kidneys, liver, and skin. Fanconi anemia is inherited in an autosomal recessive manner, meaning that both copies of the affected gene must be inherited for the disorder to manifest. The disease is rare, with an estimated incidence of about 1 in 130,000 to 1 in 350,000 births, depending on the population. While the disease is more commonly diagnosed in childhood, individuals with milder forms of FA may not show symptoms until later in life. The genetic mutations that cause FA are primarily found in the FANC gene family, which is involved in the repair of DNA breaks through a process called homologous recombination. Defects in this repair pathway lead to chromosomal abnormalities and cellular instability. Although the understanding of FA's genetic causes has significantly advanced, ongoing research is necessary to uncover further details about the underlying mechanisms and improve treatment options. The impact of Fanconi anemia is profound, not just on those affected, but also on their families and caregivers. Early diagnosis and management are crucial, and advancements in genetic testing have made it possible to identify carriers and diagnose the condition before symptoms become severe. Despite its challenges, the increased awareness of FA and the development of treatments, including bone marrow transplantation and gene therapy, offer hope for those living with the disorder. Understanding the genetic basis. Fanconi anemia, FA, is a genetically inherited disorder caused by mutations in one or more of the genes responsible for DNA repair. The condition is most commonly inherited in an autosomal recessive manner, meaning that both parents must pass on the defective gene for the child to be affected. FA is primarily associated with defects in the FANC gene family, which plays a critical role in the repair of DNA damage. These genes are involved in a process called homologous recombination, which helps to repair breaks in DNA and maintain genomic stability. When any of these genes are mutated, the DNA repair process is disrupted, leading to chromosomal instability and an increased risk of cancers, as well as various other health complications. The FANC gene family consists of at least 22 genes that have been linked to Fanconi anemia. Each of these genes produces proteins that interact with one another to form a complex known as the FA core complex. This complex is essential for initiating DNA repair mechanisms when DNA is damaged. When one of these genes is mutated, the FA core complex cannot function properly, and the body's ability to repair DNA is severely compromised. As a result, cells accumulate DNA damage over time, leading to cell death, the development of cancer, and other organ dysfunctions. The most common genetic mutations associated with FA involve the FANCA gene, which accounts for approximately 60% of all cases of the disorder. Other frequently mutated genes include FANCC, FANCD2, and FANCG. In rare cases, mutations in additional genes, such as FANC, FANCIF, and FANCL, have been identified. Each of these mutations leads to a different degree of severity, in terms of symptoms and progression of the disease, but all share the common feature of DNA repair deficiency. Genetic testing plays a vital role in diagnosing Fanconi anemia, especially in identifying carriers who do not show symptoms but can pass the condition on to their children. This testing allows for early diagnosis, which is essential for managing the condition and planning appropriate treatments. The study of FA's genetic basis is ongoing, and new discoveries are continually being made to better understand the role of these genes in both the disease and the broader context of human DNA repair mechanisms. The history of Fanconi anemia. The history of Fanconi anemia, FA, dates back to 1927, when the Swiss pediatrician Guido Fanconi first described the disorder. Fanconi was investigating a group of children who exhibited signs of congenital aplastic anemia, a condition characterized by the failure of the bone marrow to produce adequate amounts of blood cells. These children also displayed other unusual physical features, such as short stature, skin pigmentation changes, and congenital malformations. Fanconi's observations led to the identification of a new, distinct genetic condition that would later bear his name. For several decades, the disorder remained poorly understood, and its classification as a unique condition was debated among the medical community. In the mid-20th century, further research began to reveal more about the nature of Fanconi anemia. It became clear that the disorder was not just limited to blood cell production problems, but also involved significant chromosomal abnormalities, an increased risk of cancer, and a range of physical and organ-specific complications. This broadened understanding shifted the focus from just bone marrow failure to a systemic disorder affecting multiple organs. The major breakthrough in the study of FA came in the 1980s, when researchers identified that the disease was caused by defects in DNA repair mechanisms. This discovery linked FA to other genetic syndromes associated with DNA repair deficiencies, such as xeroderma pigmentosum and Bloom syndrome. By the late 1980s and early 1990s, the advent of genetic research techniques allowed scientists to map and isolate the genes responsible for FA, marking a critical turning point in the understanding of the disease's molecular basis. In the years following these breakthroughs, the identification of the FANC gene family became central to understanding the genetic mechanisms behind Fanconi anemia. The first of these genes, FANCA, was discovered in the early 1990s, followed by the identification of several other genes that contribute to the condition. These discoveries have paved the way for advancements in genetic testing and personalized medicine, allowing for earlier diagnosis and more targeted treatments. Today, the history of Fanconi anemia continues to evolve as ongoing research focuses on developing better treatment options, including bone marrow transplantation and gene therapy. The progress made since Fanconi's initial description of the disease reflects the tireless efforts of researchers and clinicians dedicated to improving the lives of those affected by this rare genetic disorder. Prevalence and impact worldwide. Fanconi anemia, FA, is a rare genetic disorder with an estimated prevalence of approximately 1 in 130,000 to 1 in 350,000 live births globally, although the figures can vary depending on the population and geographic location. The condition is more common in certain ethnic groups, such as individuals of Ashkenazi Jewish, Dutch, Spanish, and Indian descent, where the prevalence rate may be higher. In contrast, it is much rarer in other populations, such as those of African or East Asian descent. Despite its relative rarity, FA has a significant impact on affected individuals and their families, often leading to complex medical management and challenges. The prevalence of Fanconi anemia is also influenced by genetic factors, as the disorder is inherited in an autosomal recessive manner. This means that both parents must be carriers of the mutated gene for their child to inherit the disease. As a result, individuals with a family history of FA are more likely to pass on the condition. Advances in genetic testing have made it possible to identify carriers and diagnose FA in newborns and even in utero, allowing for earlier interventions and better management of the disease. The impact of Fanconi anemia extends beyond just the physical health challenges faced by patients. The condition is associated with a higher risk of cancer, particularly leukemia, and can cause severe bone marrow failure, which results in a reduced ability to produce blood cells. This can lead to frequent infections, bleeding disorders, and the need for ongoing medical interventions like blood transfusions or bone marrow transplants. In addition to blood-related issues, FA can affect other organs, including the kidneys, liver, and skin, further complicating treatment and patient care. The psychological and emotional toll on individuals with FA and their families is another significant aspect of the disorder. The uncertainty of prognosis, coupled with the need for intensive medical care, can place stress on families. Furthermore, the potential for early onset cancers and organ failure means that those affected by FA often face a shortened lifespan, which can further contribute to feelings of anxiety and loss. Globally, the awareness and understanding of Fanconi anemia have increased, thanks in part to patient advocacy groups and medical research organizations. These efforts have led to improved diagnosis, treatment options, and quality of life for many affected individuals, though challenges remain, particularly in underserved regions with limited access to healthcare. Chapter 2: Genetics of Fanconi anemia. Fanconi anemia, FA, is a genetically inherited disorder caused by mutations in any of several genes that play essential roles in DNA repair. The underlying cause of FA lies in the body's inability to properly repair damaged DNA, which leads to genomic instability, cellular dysfunction, and an increased risk of cancer. The disorder is inherited in an autosomal recessive manner, meaning that both parents must carry a defective gene for their child to inherit the condition. If both parents are carriers, there is a 25% chance that each child will inherit two mutated copies of the gene and develop FA. The genes responsible for FA are known as the FANC gene family, which consists of at least 22 distinct genes. These genes are involved in a process called homologous recombination, a critical DNA repair mechanism that fixes DNA breaks and maintains chromosomal integrity. When any of the genes in this family are mutated, the ability of the cell to repair DNA is impaired, leading to the accumulation of genetic damage that contributes to the development of FA symptoms, including bone marrow failure and cancer. Among the various genes in the FANC family, FANCA is the most commonly mutated, accounting for approximately 60% of all cases of FA. Other frequently implicated genes include FANCC, FANCD2, and FANCG. Each of these genes produces a protein that plays a specific role in the FA core complex, which is essential for initiating DNA repair. Mutations in these genes disrupt the proper function of the FA complex, resulting in defective DNA repair and genomic instability. The identification and study of the specific mutations in the FANC genes have significantly advanced our understanding of FA. By mapping and sequencing these genes, researchers can now diagnose FA more effectively through genetic testing. This allows for early identification of affected individuals, even before symptoms appear, and helps in determining the appropriate course of treatment. Additionally, the genetic analysis of FA has provided important insights into other genetic diseases and cancer mechanisms, as many of the genes involved in FA are also linked to an increased risk of leukemia and other cancers. While the genetic basis of Fanconi anemia is well understood, there are still ongoing efforts to explore how these mutations lead to the wide variety of symptoms seen in patients and to develop more effective treatments, including gene therapy and personalized medicine. The role of FANC genes. The FANC gene family plays a central role in the development of Fanconi anemia, FA, as it is responsible for the repair of damaged DNA. These genes encode proteins that work together to form a complex known as the FA core complex, which is essential for initiating the repair of DNA crosslinks and breaks. The FANC genes are involved in the homologous recombination pathway, a key process for maintaining genomic stability by repairing DNA damage, particularly damage caused by environmental factors like radiation or chemicals. When any of these genes are mutated, the FA core complex becomes dysfunctional, leading to a failure in DNA repair and the accumulation of chromosomal abnormalities that contribute to the clinical features of FA. There are at least 22 different genes in the FANC family, and mutations in these genes can lead to the development of Fanconi anemia. The most common mutation occurs in the FANCA gene, which is responsible for roughly 60% of all FA cases. Other important genes in this family include FANCC, FANCD2, FANCG, and FANC. Each of these genes encodes a specific protein that interacts with others in the FA core complex to trigger the repair process. The proteins produced by these genes help to recognize and respond to DNA damage, and they initiate the repair process by facilitating the recruitment of other repair proteins to the site of damage. The importance of the FANC genes is underscored by the fact that when these genes are mutated, the body's ability to repair DNA is severely impaired. This results in genomic instability, leading to cell death, cancer development, and the other clinical features of FA, such as bone marrow failure, congenital malformations, and organ dysfunction. Because the FANC genes are involved in such a critical cellular process, mutations in any of these genes disrupt not just the immediate repair of DNA, but also the overall function of the cell. The identification of mutations in the FANC gene family has revolutionized the diagnosis and understanding of Fanconi anemia. Genetic testing can now identify mutations in these genes, allowing for early diagnosis and better management of the disease. Additionally, ongoing research into the role of FANC genes in DNA repair is essential for developing new treatments, such as gene therapy and targeted therapies, which may one day offer a cure for FA and other genetic disorders related to DNA repair deficiencies. Inherited and acquired mutations. Fanconi anemia, FA, is primarily caused by inherited mutations, though acquired mutations also play a role in the progression of the disease. Understanding the difference between inherited and acquired mutations is crucial for grasping the complexity of FA and its clinical implications. Inherited mutations in the FANC genes are the primary cause of FA. These mutations are passed down in an autosomal recessive manner, meaning that a child must inherit 2 copies of the mutated gene, one from each parent, to develop the disorder. Individuals who inherit 1 mutated copy of the gene and 1 normal copy are considered carriers and do not show symptoms, but they can pass the mutated gene to their offspring. The inherited mutations in the FANC gene family disrupt the body's ability to repair DNA damage, leading to chromosomal instability, bone marrow failure, and a higher risk of cancers. The most common mutations occur in the FANCA gene, though several other FANC genes are also implicated in the disease. In contrast to inherited mutations, acquired mutations in FA patients typically occur as the disease progresses. These mutations arise in the affected individual's cells over time and contribute to the development of secondary cancers, such as leukemia, which are common in FA patients. As the body's DNA repair mechanisms are compromised, the accumulation of genetic mutations increases the likelihood of tumor genesis. These acquired mutations are not inherited from the parents, but instead result from the progressive loss of genetic stability within the individual's cells. They can occur in a variety of genes, including those involved in the regulation of cell growth and division, further exacerbating the cancer risk in FA patients. Acquired mutations can also affect other aspects of the disease. For example, in the case of bone marrow failure, the accumulation of mutations in hematopoietic stem cells can lead to a decline in blood cell production, exacerbating the symptoms of anemia, infections, and bleeding. The ability of FA cells to repair DNA becomes more impaired with the addition of acquired mutations, further complicating treatment and prognosis. While inherited mutations form the foundation of Fanconi anemia, acquired mutations are an important factor in disease progression and the development of secondary complications. Understanding both types of mutations is essential for advancing research into treatments and improving patient care, particularly with regard to early detection and the management of cancer risks. Mechanisms of genomic instability. Genomic instability is a hallmark of Fanconi anemia, FA, and plays a central role in the development of the disease. The primary mechanism behind this instability is the failure of DNA repair pathways, particularly those involving the FANC genes, which are responsible for initiating the repair of damaged DNA. In individuals with FA, mutations in any of the FANC genes disrupt normal DNA repair processes, leading to an accumulation of DNA damage that compromises the integrity of the genome and contributes to various clinical manifestations of the disease, including bone marrow failure and a predisposition to cancers. The FANC genes are involved in a process known as homologous recombination, a form of DNA repair that fixes DNA double-strand breaks. These breaks can occur due to exposure to environmental factors, such as radiation or chemicals, or as a result of normal cellular processes. In a healthy individual, the FA core complex, which is made up of the proteins encoded by the FANC genes, recognizes DNA damage and triggers the appropriate repair mechanisms. However, when one or more of the FANC genes is mutated, the core complex is dysfunctional, leading to an inability to effectively repair DNA damage. This failure results in the accumulation of chromosomal breaks, rearrangements, and other forms of genetic instability. The lack of proper DNA repair causes the genome to become unstable, meaning that cells cannot maintain the integrity of their genetic material. This instability is particularly dangerous because it can lead to the loss of critical genes or the activation of oncogenes, both of which are common features of cancer cells. In FA patients, genomic instability significantly increases the risk of developing cancers, especially leukemia. It also contributes to bone marrow failure, as the hematopoietic stem cells in the bone marrow are unable to properly repair DNA damage, leading to their dysfunction and eventual decline in blood cell production. In addition to its role in bone marrow failure and cancer risk, genomic instability in FA can also cause other organ-specific complications. The inability to repair DNA damage in tissues such as the kidneys, liver, and skin can lead to organ dysfunction and malformations. The accumulation of mutations in these tissues over time can further impair their function, making it harder for individuals with FA to manage the condition. Overall, the mechanisms of genomic instability in Fanconi anemia are driven by defective DNA repair, leading to a cascade of effects that contribute to the disease's multisystemic nature. This instability underscores the need for advanced therapies that can address the underlying genetic defects and reduce the risks associated with the disorder. Chapter 3: Clinical Manifestations of Fanconi Anemia. Fanconi anemia, FA, is a complex genetic disorder that affects multiple systems in the body, resulting in a range of clinical manifestations. The most prominent and early feature of FA is bone marrow failure, which typically becomes apparent in childhood. Bone marrow failure in FA patients leads to a reduced production of blood cells, resulting in anemia, increased susceptibility to infections, and a tendency to bleed easily. This condition often requires regular blood transfusions to manage the symptoms and maintain the patient's health. In addition to hematologic abnormalities, FA is associated with a variety of physical anomalies. These can include short stature, abnormal skin pigmentation, and distinct facial features such as a flat nose, small eyes, and a high forehead. Many individuals with FA also experience skeletal abnormalities, including malformations of the fingers, arms, and legs, which can cause significant mobility issues. These physical manifestations can vary in severity, and some individuals may have more pronounced features than others. Another critical aspect of FA is its strong association with an increased risk of cancer. Children and young adults with FA are more prone to developing leukemia, particularly acute myelogenous leukemia (AML), as well as other cancers, including solid tumors of the liver, head and neck, and skin. The risk of developing cancer is due to the underlying genomic instability caused by the defective DNA repair mechanisms in FA patients. The failure to repair DNA damage increases the likelihood of mutations that lead to cancer development. Kidney and liver dysfunction are also common in individuals with FA. Kidney abnormalities, such as structural malformations and impaired kidney function, may be present from birth. These issues can progress over time and lead to kidney failure in some patients. Similarly, liver problems, including hepatomegaly, enlarged liver, and an increased risk of cirrhosis, can complicate the clinical picture of FA. Additionally, skin pigmentation changes are often seen, with dark patches or freckling on the skin, particularly on the face, neck, and shoulders. As FA progresses, the severity of these manifestations tends to increase, and complications related to bone marrow failure, organ dysfunction, and cancer risk often require intensive medical interventions, such as bone marrow transplants, chemotherapy, and ongoing supportive care. Understanding the clinical manifestations of Fanconi anemia is essential for early diagnosis and effective management of the disorder, allowing for interventions that can improve the quality of life and extend lifespan for affected individuals. Physical symptoms and diagnosis. The physical symptoms of Fanconi anemia, FA, are diverse and can vary in severity from one individual to another. Early signs of FA often appear in childhood, although some symptoms may develop later. One of the most common and noticeable physical features is short stature. Many children with FA are shorter than their peers, and growth delays are a hallmark of the condition. Additionally, distinctive facial features such as a high forehead, flat nose, and small or widely spaced eyes are often present. These physical traits are part of the broader spectrum of congenital abnormalities associated with FA. Skin pigmentation changes are another characteristic symptom. Individuals with FA often have irregular skin pigmentation, such as dark patches or freckling, particularly on the face, neck, and shoulders. These changes in skin appearance can be one of the first signs, prompting further investigation into the possibility of FA. Skeletal abnormalities are also commonly observed, with some individuals having malformations of the fingers, such as shortened or missing digits, as well as problems with the bones in the arms and legs. These skeletal issues can lead to mobility challenges and require additional care. In addition to the physical symptoms, FA is associated with a range of other health concerns, particularly bone marrow failure. This failure leads to a reduced ability to produce blood cells, resulting in anemia, frequent infections, and increased bleeding tendencies. As a result, individuals with FA often experience fatigue, pallor, and a need for regular blood transfusions. These hematological issues are critical to the diagnosis of FA and are typically the first signs that prompt clinicians to investigate the possibility of the disorder. The diagnosis of Fanconi anemia is based on a combination of clinical findings, family history, and genetic testing. Physicians look for the characteristic physical symptoms, particularly the short stature, facial abnormalities, and skin pigmentation changes, which can raise suspicion. Blood tests are performed to assess bone marrow function and the levels of various blood cells. Once FA is suspected, genetic testing is used to confirm the diagnosis by identifying mutations in one of the FANC genes. This genetic test is crucial for identifying affected individuals, especially those with milder symptoms, and allows for early intervention and genetic counseling for families. Early diagnosis of FA is essential for managing the disease and preventing complications. Genetic counseling is also important for families, as FA is inherited in an autosomal recessive manner, meaning both parents must be carriers for their child to be affected. Bone marrow failure. Bone marrow failure is a hallmark feature of Fanconi anemia, FA, and represents one of the most serious and life-threatening aspects of the disorder. The bone marrow is responsible for producing blood cells, including red blood cells, white blood cells, and platelets. In individuals with FA, the defective DNA repair mechanisms caused by mutations in the FANC genes lead to the progressive failure of the bone marrow. This results in a condition known as aplastic anemia, where the bone marrow's ability to produce blood cells is severely compromised. The onset of bone marrow failure in FA typically occurs during childhood, although the timing can vary. The first signs often include symptoms related to low blood cell counts, such as fatigue, weakness, frequent infections, and easy bruising or bleeding due to a shortage of red blood cells, white blood cells, and platelets, respectively. Anemia, characterized by low red blood cell counts, leads to pallor and fatigue, while a reduced number of white blood cells increases the risk of infections. Platelet deficiency can result in bleeding episodes, including nosebleeds, gum bleeding, and prolonged bleeding after cuts or injuries. As bone marrow failure progresses in FA, it becomes increasingly difficult for the body to maintain normal blood cell counts. Without intervention, the condition can become life-threatening with severe consequences, including life-threatening infections and uncontrolled bleeding. In some cases, individuals with FA may require frequent blood transfusions to compensate for the bone marrow's inability to produce sufficient blood cells. These transfusions can temporarily alleviate some of the symptoms, but they do not address the underlying issue of bone marrow dysfunction. The treatment of bone marrow failure in FA often involves a bone marrow or stem cell transplant, which aims to replace the defective bone marrow with healthy marrow from a donor. This treatment can be life-saving and may help restore normal blood cell production. However, bone marrow transplants carry significant risks, including the potential for graft versus host disease, infection, and complications related to immunosuppression. In addition to bone marrow transplants, other therapies, such as the use of growth factors to stimulate blood cell production, may be considered. However, these treatments do not address the root cause of the disease, which is the genetic defect in DNA repair. As such, ongoing research into gene therapy and other innovative treatments offers hope for improving outcomes and potentially curing Fanconi anemia in the future. Associated cancers and organ damage. One of the most significant risks associated with Fanconi anemia, FA, is the increased susceptibility to cancers. The defective DNA repair mechanisms caused by mutations in the FANC genes lead to genomic instability, a characteristic feature of cancerous cells. As a result, individuals with FA have a heightened risk of developing malignancies, particularly leukemia, as well as a variety of solid tumors. The most common cancer associated with FA is acute myelogenous leukemia, AML, which can develop due to the accumulation of genetic mutations in hematopoietic stem cells. These mutations impair the function of blood cells, leading to leukemia in many affected individuals. In addition to leukemia, individuals with FA are at an increased risk of developing other cancers, such as head and neck cancers, liver cancer, and skin cancers. Solid tumors can arise in multiple organs, including the kidneys, liver, and gastrointestinal tract, as the underlying genomic instability in FA cells allows for uncontrolled cell division and tumor formation. The risk of cancer increases with age, and many individuals with FA will eventually face one or more malignancies during their lifetime. Aside from cancer, FA is also associated with significant organ damage. The defective DNA repair mechanisms that lead to cancer also affect other organs, contributing to their dysfunction over time. Kidney abnormalities are common in FA patients, with structural malformations and a higher risk of kidney failure. This can lead to progressive renal dysfunction, requiring interventions such as dialysis or, in some cases, kidney transplantation. Liver damage is another concern, as FA patients have a higher likelihood of developing hepatomegaly, enlarged liver, cirrhosis, and even liver failure. These complications can significantly impact the quality of life and require ongoing monitoring and management. The skin is another organ that can be affected in FA, with patients often presenting with hyperpigmentation, freckles, or other skin changes. These dermatologic manifestations are not just cosmetic, but may reflect the underlying genomic instability that affects all tissues in the body. As these organs become damaged over time, the severity of the clinical symptoms increases, further complicating the management of the disorder. Given the high risk of cancer and organ damage, individuals with FA require vigilant medical monitoring and early interventions. Bone marrow transplants, while life-saving for treating bone marrow failure, do not necessarily address the long-term risks of cancer and organ dysfunction. Thus, ongoing research into targeted therapies and gene therapies is critical to improving the prognosis and quality of life for individuals living with Fanconi anemia. Chapter 4: Diagnostic Approaches. The diagnosis of Fanconi anemia, FA, relies on a combination of clinical assessment, family history, laboratory testing, and genetic analysis. Early diagnosis is critical for managing the condition and providing appropriate interventions. FA is often suspected when a patient presents with the hallmark symptoms, such as bone marrow failure, congenital abnormalities, and characteristic physical features like short stature and skin pigmentation changes. However, because these symptoms can be present in other disorders as well, diagnostic testing is required to confirm the diagnosis. The first step in diagnosing FA typically involves a thorough clinical evaluation, including a detailed medical and family history. FA is inherited in an autosomal recessive manner, so a family history of unexplained bone marrow failure or genetic disorders may raise suspicion. Physical features, such as unusual facial characteristics, skeletal abnormalities, and skin pigmentation, also guide the clinician toward further testing. Once FA is suspected, the next step is often laboratory testing to assess the function of the bone marrow. Blood tests are used to measure the levels of red blood cells, white blood cells, and platelets. Individuals with FA typically show pancytopenia, a deficiency in all types of blood cells, which is a key indicator of bone marrow failure. However, these blood tests alone cannot confirm the diagnosis, as other conditions may cause similar hematologic abnormalities. The definitive diagnosis of Fanconi anemia is made through genetic testing. This involves sequencing the FANC gene family to identify mutations in one or more of the 22 known FA-associated genes. Genetic testing can be done using a blood sample, and the presence of mutations in these genes confirms the diagnosis. Identifying the specific gene mutations responsible for FA is important not only for diagnosing the condition, but also for guiding treatment decisions and providing genetic counseling for affected families. In addition to genetic testing, a chromosome breakage test is sometimes used in the diagnosis of FA. This test involves exposing patient cells to DNA-damaging agents, such as deoxybutane, and examining the frequency of chromosomal breaks. A significantly increased number of chromosomal breaks is a characteristic feature of FA, reflecting the defective DNA repair mechanisms in the affected cells. While this test is not as commonly used today due to the availability of genetic testing, it can still provide valuable diagnostic information in certain cases. Overall, the diagnostic approach to Fanconi anemia is multifaceted, combining clinical features, laboratory tests, and genetic analysis. Early diagnosis is essential for managing the condition and improving outcomes, as it allows for appropriate interventions, including bone marrow transplants and other therapies aimed at addressing the underlying genetic defect. Genetic testing and screening. Genetic testing and screening are vital tools in the diagnosis and management of Fanconi anemia, FA. Given that FA is a genetic disorder caused by mutations in one or more of the FANC genes, identifying these mutations is key to confirming the diagnosis, understanding the severity of the condition, and guiding treatment decisions. Additionally, genetic testing plays a crucial role in family planning and genetic counseling for those with a known family history of FA. Genetic testing for FA involves sequencing the FANC gene family to identify mutations. There are 22 known FANC genes, and mutations in any of these can lead to FA. The most common mutations are found in the FANCA gene, though mutations in other genes like FANC, FANCD2, and FANCG also contribute to the disease. Genetic testing is typically performed on a blood sample and can provide a definitive diagnosis. By identifying the specific gene mutations, healthcare providers can better understand the patient's condition, which can influence the choice of treatments such as bone marrow transplants or gene therapy. In addition to diagnostic genetic testing, genetic screening may be recommended for individuals with a family history of FA or for those who are at risk of being carriers. Carrier screening is especially important for individuals with known relatives affected by FA, as the disorder follows an autosomal recessive inheritance pattern. Carriers who inherit one mutated copy of the gene usually do not show symptoms but can pass the mutated gene to their children. Genetic screening for carriers is an important tool in family planning, as it helps potential parents understand their risk of having a child with FA. Prenatal genetic testing is another option for families at risk of FA. If both parents are known carriers, genetic testing can be performed on a fetus to determine if it has inherited two mutated copies of a FANC gene. This allows for early diagnosis before birth, which can help guide medical decisions and prepare for the management of the disorder. Genetic counseling is a crucial aspect of genetic testing and screening. It provides families with the necessary information to understand the implications of genetic test results, both for the individual patient and for other family members. Counseling can help families navigate the emotional and logistical aspects of managing a genetic disorder and make informed decisions about treatment options and family planning. In summary, genetic testing and screening are essential in the diagnosis, treatment, and management of Fanconi anemia. These tests provide critical information about the genetic basis of the disorder, help identify carriers, and enable families to make informed decisions regarding treatment and reproductive choices. Chromosomal breakage test. The chromosomal breakage test is a diagnostic tool used in the identification of Fanconi anemia, FA, particularly when genetic testing is not immediately available or when further confirmation of the diagnosis is needed. This test is based on the premise that individuals with FA exhibit a heightened sensitivity to DNA-damaging agents, resulting in an increased number of chromosomal breaks. The test works by exposing patient cells, usually cultured skin or blood cells, to a DNA cross-linking agent, such as depoxybutane, DEB, or mitomycin C. These agents induce DNA damage, and the cells are then examined under a microscope to assess the extent of chromosomal breakage. In a healthy individual, the DNA repair mechanisms are able to recognize and correct damage induced by the cross-linking agents, resulting in minimal chromosomal breakage. However, in individuals with FA, the inability to repair DNA damage properly leads to a significantly higher number of chromosomal breaks, especially in the chromosomes of dividing cells. The number of breaks and the patterns of breakage can be quantified and used to assess the likelihood of FA. An increased frequency of chromosomal breaks, especially in response to DNA-damaging agents, is a strong indicator of the disorder. While the chromosomal breakage test can provide valuable diagnostic information, it has largely been replaced by genetic testing in many clinical settings due to the ability to directly identify mutations in the FANC genes. However, the chromosomal breakage test can still be useful in certain situations, such as when genetic testing is not readily available or when a rapid diagnosis is needed. It is also important to note that the chromosomal breakage test is not 100% specific to FA. Other conditions that affect DNA repair mechanisms may also result in chromosomal breakage, so it is typically used in conjunction with other diagnostic tools. The chromosomal breakage test has been instrumental in advancing our understanding of FA and providing early diagnosis in affected individuals. It remains an important tool in clinical practice, particularly in areas where genetic testing may not be as accessible. Early detection and its importance. Early detection of Fanconi anemia, FA, is crucial for improving the outcomes of affected individuals. Given the progressive nature of the disease, with its associated risks of bone marrow failure, organ damage, and increased cancer susceptibility, identifying the disorder at an early stage allows for timely intervention and better management of the condition. This can significantly improve quality of life, reduce the severity of symptoms, and extend life expectancy. One of the most critical aspects of early detection is the opportunity to manage bone marrow failure, one of the most dangerous and life-limiting complications of FA. Bone marrow failure can begin in childhood and leads to anemia, increased risk of infection, and bleeding. Early diagnosis enables healthcare providers to monitor the condition closely and, in some cases, begin treatments like blood transfusions or bone marrow transplants before the bone marrow fails completely. These interventions can greatly improve the chances of survival and delay the onset of more severe complications. Additionally, early detection is vital for managing the increased risk of cancers associated with FA. Individuals with FA are at a significantly higher risk of developing leukemia and solid tumors, particularly in the head, neck, skin, and liver. Regular monitoring through early detection can help identify malignancies at a stage when they are more treatable, improving the prognosis for these patients. Cancer screenings and vigilant monitoring are essential in reducing mortality rates associated with these secondary conditions. Genetic testing plays a central role in early detection, especially for families with a known history of FA. Prenatal testing and carrier screening can help identify the presence of the genetic mutations responsible for FA before birth or early in childhood. This allows parents to make informed decisions about their child's care and future health. In cases where FA is suspected due to symptoms, early genetic testing can provide confirmation of the diagnosis, allowing for the prompt initiation of appropriate treatments. Overall, early detection of FA offers a range of benefits, from enabling early intervention to improving the management of complications such as bone marrow failure and cancer. It empowers families and healthcare providers to take proactive measures to improve the health and well-being of individuals living with Fanconi anemia, emphasizing the importance of regular screenings, genetic counseling, and close medical monitoring. Chapter 5: Treatment Options and Management. The treatment of Fanconi anemia, FA, involves a multifaceted approach aimed at managing the various complications of the disorder, particularly bone marrow failure and the heightened risk of cancer. Given the severity of these risks, treatment strategies are tailored to the individual, taking into account their specific symptoms, age, and overall health. One of the most effective treatments for FA is hematopoietic stem cell transplantation, HSCT, commonly referred to as a bone marrow transplant. HSCT is often the first line of treatment for individuals with severe bone marrow failure, as it can provide a long-term solution by replacing the defective bone marrow with healthy donor cells. Successful transplants can restore normal blood cell production and significantly improve survival rates. However, bone marrow transplants come with substantial risks, including graft versus host disease, GVHD, infections, and organ complications, which require careful monitoring and post-transplant care. For patients who are not candidates for HSCT or who do not have a suitable donor, alternative treatments such as immunosuppressive therapy may be used. These therapies, which include drugs like antithymocyte globulin, ATG, and cyclosporin, aim to suppress the immune system to allow the patient's bone marrow to recover and produce blood cells more effectively. While this approach can provide temporary relief and improvement in blood counts, it does not address the underlying genetic defect in FA and is not a permanent solution. In addition to bone marrow-related treatments, individuals with FA require regular monitoring for associated cancers, particularly leukemia, solid tumors, and skin cancers. Early detection through regular screenings is crucial for improving the prognosis of these malignancies. In some cases, treatment for cancer may involve chemotherapy, radiation therapy, or surgical intervention, depending on the location and type of tumor. However, due to the increased sensitivity to DNA damage in FA patients, the use of chemotherapy and radiation must be carefully managed to avoid exacerbating the DNA damage in healthy cells. Supportive treatments are also an essential part of managing FA. These may include blood transfusions to address anemia, antibiotics to prevent infections, and platelet transfusions to manage bleeding risks. Additionally, growth factors such as erythropoietin, EPO, or granulocyte colony-stimulating factor, GCSF, may be used to stimulate blood cell production in the bone marrow. In conclusion, the management of Fanconi anemia requires a comprehensive and individualized treatment approach. While bone marrow transplants offer the potential for a cure, ongoing management through supportive care, cancer screenings, and genetic counseling plays a vital role in improving the quality of life and overall survival for individuals living with FA. Bone marrow transplantation. Bone marrow transplantation, BMT, is the most effective and widely used treatment for severe cases of Fanconi anemia, FA, particularly for those who experience bone marrow failure. This procedure involves replacing the patient's defective bone marrow with healthy stem cells from a compatible donor, typically a sibling or an unrelated donor who is a close match. The goal is to restore normal blood cell production and improve survival outcomes by addressing the underlying cause of FA, which is the inability of the bone marrow to produce sufficient blood cells. The process of bone marrow transplantation begins with finding a suitable donor. The most ideal donor is a sibling who shares the same genetic makeup, as this minimizes the risk of complications such as graft versus host disease, GVHD. In cases where a sibling is unavailable or not a perfect match, the search for an unrelated donor through bone marrow registries can be considered. The donor's stem cells are then harvested, usually from the bone marrow or peripheral blood, and transplanted into the patient's bloodstream. Following the transplant, the patient undergoes intensive conditioning, which typically involves chemotherapy and/or radiation therapy to destroy the patient's diseased bone marrow and make room for the donor's cells. While these treatments are crucial for the success of the transplant, they also carry significant risks, including further immune suppression and increased susceptibility to infections. After the transplant, the patient's immune system begins to recover as the donor's stem cells take root in the bone marrow. This process can take several months, during which time the patient is closely monitored for complications such as infections, bleeding, and GVHD. GVHD occurs when the transplanted immune cells from the donor recognize the recipient's body as foreign and attack healthy tissues, leading to a range of symptoms affecting the skin, liver, and gastrointestinal system. The success of a bone marrow transplant for FA depends on several factors, including the patient's age, overall health, the degree of bone marrow failure, and how well the patient's body accepts the donor cells. For younger patients and those who receive transplants early in the course of their disease, outcomes tend to be better. However, as with any major medical procedure, there are risks involved, and not all patients will experience a complete recovery. In summary, bone marrow transplantation remains the cornerstone of treatment for severe Fanconi anemia, offering the possibility of a long-term cure for those who undergo the procedure. Despite the risks, the benefits of successful transplantation in restoring normal blood cell production and improving survival make it a critical treatment option for individuals with FA. Gene therapy advances. Gene therapy has emerged as a promising potential treatment for Fanconi anemia, FA, offering the possibility of correcting the genetic defect underlying the disorder. The primary goal of gene therapy for FA is to introduce a functional copy of the affected gene into the patient's cells, thereby restoring the ability of the cells to repair DNA damage and improving the function of the bone marrow. This approach could provide a long-term solution for patients with FA, reducing or eliminating the need for bone marrow transplants and addressing the root cause of the disease. One of the most significant advances in gene therapy for FA has been the development of safer and more efficient methods for delivering the therapeutic genes to the patient's cells. The most common technique used in gene therapy for FA involves using viral vectors, such as lentiviruses, to carry the corrected genetic material into the patient's stem cells. These stem cells are typically harvested from the patient's bone marrow, modified in the laboratory with the therapeutic gene, and then transplanted back into the patient. This method, known as ex vivo gene therapy, allows for the correction of the genetic defect without directly altering the patient's DNA in the body, reducing the risk of complications. Recent clinical trials have shown promising results for gene therapy in FA patients, with some individuals achieving sustained improvements in blood counts and bone marrow function. These trials have demonstrated that gene therapy can restore normal blood cell production in patients who previously had severe bone marrow failure. While the early results are encouraging, there are still many challenges to overcome before gene therapy can become a routine treatment for FA. One of the major hurdles is ensuring that the modified stem cells are able to persist and function effectively in the patient's bone marrow over the long term. Additionally, the potential for immune responses to the viral vectors used to deliver the gene remains a concern. Despite these challenges, gene therapy represents an exciting frontier in the treatment of FA. As research and technology continue to advance, gene therapy has the potential to offer a more permanent and less invasive solution than traditional treatments like bone marrow transplantation. Ongoing studies and trials are expected to further refine the technique, with the hope that gene therapy will eventually become a standard treatment option for individuals with FA, improving both the quality of life and life expectancy for those affected by the disorder. Supportive therapies and symptom management. Supportive therapies play a crucial role in managing the various symptoms and complications associated with Fanconi anemia, FA, particularly for individuals who are not candidates for bone marrow transplantation or for those undergoing treatment to address bone marrow failure. Since FA is a progressive condition, the goal of supportive therapies is to alleviate symptoms, manage complications, and improve the patient's quality of life. One of the primary supportive therapies used in the management of FA is blood transfusion therapy. Many individuals with FA experience bone marrow failure, which leads to a reduced production of red blood cells, white blood cells, and platelets. Blood transfusions help maintain healthy levels of these cells, thus reducing the risk of anemia, infection, and bleeding. Transfusions may be required on a regular basis, depending on the severity of the patient's condition, and can be combined with other treatments, such as iron chelation therapy, to address complications like iron overload, which can occur with frequent transfusions. In addition to blood transfusions, patients with FA often require medications to manage their immune system and to prevent infections. Immunosuppressive therapy, such as the use of antithymocyte globulin (ATG) and cyclosporin, can help improve bone marrow function by reducing immune-mediated damage to the bone marrow. However, these treatments are generally considered temporary measures, as they do not address the root cause of FA. Patients undergoing immunosuppressive therapy need to be closely monitored for infections and other complications related to immune suppression. Growth factors such as erythropoietin, EPO, and granulocyte colony stimulating factor, GCSF, are also used as supportive treatments to stimulate the production of red blood cells and white blood cells. These medications can help manage low blood counts and reduce the frequency of transfusions. However, they are not a cure for the underlying genetic defect and are typically used in conjunction with other therapies. Symptom management is also essential for addressing the various physical manifestations of FA, including developmental delays, organ damage, and cancers. Regular screenings for cancer, especially leukemia and solid tumors, are critical for early detection and intervention. Additionally, physical therapy and occupational therapy may be employed to support individuals with physical disabilities or developmental delays. In conclusion, while there is no cure for Fanconi anemia, supportive therapies are essential in managing the condition and improving the patient's quality of life. These treatments help control symptoms, reduce complications, and offer a better outlook for individuals with FA, allowing them to live fuller, more active lives despite the challenges posed by the disease. Chapter 6: Challenges in Fanconi anemia research. Research into Fanconi anemia, FA, has made significant strides over the years, yet many challenges remain in fully understanding and treating the disease. FA is a rare genetic disorder, and its complexity, combined with the diverse ways in which it manifests in patients, poses numerous hurdles for researchers. These challenges impact both the understanding of the disease's mechanisms and the development of effective treatments. One of the major challenges in FA research is the rarity of the condition. With a limited number of patients worldwide, recruiting individuals for clinical studies and trials can be difficult. This scarcity makes it harder to collect large datasets that are crucial for understanding the full spectrum of FA's clinical presentations. Moreover, the genetic diversity of FA patients complicates the creation of standardized treatment protocols, as the disorder can manifest differently depending on the specific genetic mutations present. This variability increases the complexity of research and limits the ability to generalize findings across all individuals with FA. Another significant challenge is the complexity of the genetic mutations that cause FA. The disease is associated with defects in any one of the several FANC genes, each contributing differently to DNA repair mechanisms. Identifying the precise genetic mutations in a patient's DNA is often difficult, and even when the mutation is found, understanding its exact impact on cellular function and how it contributes to the progression of the disease remains an ongoing research effort. This complexity makes it challenging to develop gene therapy treatments that can effectively correct the underlying defect in all FA patients. Additionally, FA's effects on the body are multifaceted, involving not only bone marrow failure but also increased cancer risks, organ damage, and developmental delays. These diverse effects require research to explore a wide range of therapeutic strategies, from gene therapy to cancer treatments and supportive therapies. The need for such comprehensive research increases the difficulty of focusing efforts on one specific area, as advances in one domain may not directly translate into improvements in others. Finally, while advances in gene therapy show promise, there are still many technical and ethical challenges to overcome. Ensuring the safe and effective delivery of therapeutic genes into a patient's cells, managing the risks of immune responses, and addressing the long-term outcomes of such treatments remain significant hurdles. In conclusion, while Fanconi anemia research has made remarkable progress, the rarity of the disease, the complexity of its genetic mutations, and its multifaceted impact on the body continue to present significant challenges. Addressing these obstacles will require ongoing collaboration, innovation, and investment in both scientific research and clinical trials. Limited understanding of disease mechanisms. One of the significant challenges in Fanconi anemia, FA, research is the limited understanding of the disease mechanisms. While the genetic basis of FA has been well established, with mutations in the FANC genes leading to defects in DNA repair, the full scope of how these mutations cause the varied symptoms of the disease remains unclear. The complexity of the genetic interactions, as well as the diverse ways in which the disorder manifests in different patients, adds to the difficulty in understanding the underlying mechanisms that drive the progression of FA. FA is primarily characterized by bone marrow failure, but its effects extend beyond the hematologic system. Patients are also at increased risk for various cancers, including leukemia, and can experience developmental delays and organ damage. However, how the DNA repair defects in FA lead to these systemic issues is still not fully understood. Researchers are working to uncover how mutations in the FANC genes affect cellular processes, such as replication, repair, and response to DNA damage, but these processes are intricate and not easily studied in human models. Another factor contributing to the limited understanding of FA mechanisms is the heterogeneity of the disease. FA does not present in a uniform manner across all patients, even those with the same genetic mutation. Some individuals may experience early onset bone marrow failure, while others may remain asymptomatic for a longer period. Similarly, the development of cancer in FA patients is highly variable. This variability complicates efforts to develop a unified model of disease progression and treatment response. It suggests that there may be other genetic or environmental factors at play that influence the severity and type of symptoms experienced by each patient. In addition to the genetic complexity, the challenge of modeling FA in laboratory settings further hinders progress. While animal models and cell cultures have provided valuable insights, they do not always fully replicate the human experience of the disease. The difficulties of creating accurate models of FA limit the ability of researchers to test potential therapies and gain a deeper understanding of the mechanisms behind the disease. In summary, despite significant advances in our knowledge of Fanconi anemia, the mechanisms that link the genetic mutations to the diverse clinical manifestations of the disease remain poorly understood. This gap in knowledge makes it difficult to develop targeted therapies and further complicates efforts to find effective treatments for the various aspects of FA. Continuing research efforts, better models, and improved understanding of genetic interactions are critical to overcoming these challenges. Barriers in gene therapy development. Gene therapy holds great promise for treating Fanconi anemia, FA, offering the potential to correct the underlying genetic mutations responsible for the disorder. However, several significant barriers remain in the development and widespread implementation of gene therapy for FA. These challenges stem from both technical and biological factors that make gene therapy a complex and often risky endeavor. One of the primary obstacles is the difficulty in delivering the therapeutic genes to the patient's cells effectively. In gene therapy for FA, the goal is to introduce a functional copy of the defective gene into the patient's bone marrow stem cells. This process typically involves using viral vectors, such as lentiviruses, to transport the therapeutic gene into the target cells. While viral vectors have shown promise, they come with limitations, including potential immune responses that could lead to complications or the elimination of the transplanted cells. Additionally, achieving the right level of gene expression to restore normal cellular function remains a challenge, as the therapeutic gene must be delivered in a way that mimics the natural expression of the gene in healthy individuals. Another barrier is ensuring the long-term persistence and stability of the modified cells. Even if the gene is successfully delivered and incorporated into the patient's DNA, there is a risk that the corrected cells may not survive long-term in the bone marrow or may not adequately replace the dysfunctional cells. The durability of the gene therapy is critical to its success, as patients will require ongoing production of blood cells to prevent bone marrow failure. Ensuring that the corrected cells are not outcompeted by the patient's native stem cells is a key challenge in gene therapy development. Safety concerns also present a significant barrier to the widespread adoption of gene therapy. The use of viral vectors carries the risk of insertional mutagenesis, where the therapeutic gene integrates into an unintended location in the genome, potentially leading to the activation of oncogenes or the disruption of other important genes. Additionally, gene therapy procedures involve significant manipulation of the patient's cells, which poses inherent risks, such as infections or other complications associated with the transplant process. Finally, the high cost of gene therapy research and treatment is another major hurdle. Developing and testing gene therapy for FA requires significant financial resources, and even after a successful therapy is developed, the cost of treatment could make it inaccessible to many patients, particularly in low-resource settings. In conclusion, while gene therapy represents a promising avenue for the treatment of Fanconi anemia, significant barriers remain in terms of delivery efficiency, safety, long-term efficacy, and cost. Overcoming these obstacles will require continued research, innovation, and collaboration to make gene therapy a viable treatment option for FA patients in the future. The need for more clinical trials. Clinical trials are essential for advancing the treatment and management of Fanconi anemia, FA, yet there is a significant need for more research and clinical studies to better understand the disease and develop effective therapies. Despite the progress made in recent years, FA remains a complex and rare genetic disorder, and the lack of extensive clinical data continues to limit the development of targeted, evidence-based treatments. One of the primary reasons for the need for more clinical trials is the rarity of the condition. FA affects a small population, making it challenging to recruit enough participants for large-scale trials. This scarcity of patients complicates efforts to gather comprehensive data that can provide insights into disease progression, treatment efficacy, and long-term outcomes. As a result, clinical trials often suffer from small sample sizes, which can limit the ability to generalize findings and make it harder to detect statistically significant results. Larger and more diverse clinical trials are necessary to improve our understanding of how FA affects patients from different genetic backgrounds and regions, ensuring that findings are applicable to the broader population. Another challenge is the limited number of treatment options currently available for FA. While bone marrow transplantation remains the standard treatment for many patients, it is not suitable for all individuals, and its effectiveness varies. Other therapeutic approaches, such as gene therapy and immunosuppressive treatments, are still in the experimental stages. More clinical trials are needed to evaluate the safety and efficacy of these new therapies, explore potential combination treatments, and refine treatment protocols for different patient subgroups. Furthermore, clinical trials are essential for exploring the long-term effects of current treatments. Many FA patients receive bone marrow transplants or other interventions early in life, and the long-term outcomes of these treatments are not fully understood. Clinical trials that track the progression of FA over the course of a patient's lifetime can help identify late-onset complications, such as cancer, organ failure, or neurological issues, which can inform future care strategies and improve quality of life for individuals living with FA. In addition, more clinical trials are needed to address the psychosocial aspects of FA. The emotional and psychological burden of living with a rare genetic disorder is often overlooked, but these factors are just as important in improving patient outcomes. Clinical trials that explore the mental health and quality of life aspects of FA can help healthcare providers offer more comprehensive care for patients and their families. In conclusion, more clinical trials are crucial for advancing the understanding of Fanconi anemia, improving current treatment options, and ultimately finding a cure. By expanding the scope of clinical research, we can better address the diverse needs of FA patients and improve their outcomes in both the short and long term. Chapter 7: Psychological and Social Impacts. Fanconi anemia, FA, presents not only a physical challenge but also a significant emotional and social burden for patients and their families. Living with a rare genetic disorder that often manifests early in life can have profound effects on mental health, family dynamics, and social relationships. The chronic nature of FA, coupled with its life-threatening implications, creates a unique psychological landscape that requires just as much attention as the physical symptoms of the disease. Children diagnosed with FA often undergo frequent medical visits, rigorous testing, and invasive procedures, which can lead to feelings of anxiety, fear, and isolation. The unpredictable progression of the disorder can further contribute to emotional instability, particularly as they begin to understand the seriousness of their condition. Adolescents with FA may struggle with identity issues and peer relationships, especially when physical differences or treatment side effects, such as growth delays or visible scars, make them feel different from their peers. Parents and caregivers face their own emotional challenges. The stress of managing a child's medical needs, navigating complex healthcare systems, and dealing with the potential for a shortened lifespan can be overwhelming. Feelings of helplessness, guilt, and chronic anxiety are common, and these emotions can strain familial relationships and impact the mental health of caregivers. Siblings of affected individuals may also experience neglect, confusion, or jealousy, leading to further complications within the family dynamic. The social implications of FA extend beyond the household. Due to the rarity of the disease, patients and families often feel isolated and misunderstood, both socially and within the medical community. Support networks may be limited, and finding others who truly understand the daily challenges of living with FA can be difficult. This isolation can deepen emotional struggles and make it harder to cope with the demands of the illness. Education and employment can also be affected. Young patients may miss extended periods of school due to treatment or hospitalization, impacting academic performance and social development. Adults living with milder forms of FA may face workplace discrimination or difficulties maintaining stable employment due to health-related limitations or frequent medical appointments. Addressing the psychological and social impacts of Fanconi anemia is essential for improving the overall well-being of those affected. Integrating mental health services into standard care, offering support groups, and increasing public awareness of the disease are critical steps in ensuring that patients and their families are not left to navigate the emotional challenges of FA alone. A holistic approach that includes psychological support can significantly enhance quality of life and provide much-needed relief in the face of a complex and demanding diagnosis. Coping with chronic illness. Living with Fanconi anemia, FA, requires not only medical treatment but also emotional strength and adaptability. As a chronic, life-altering condition, FA presents ongoing challenges that can impact every aspect of an individual's life, from physical health to mental well-being. Coping with a chronic illness like FA is a continuous process that involves building resilience, finding support, and maintaining a sense of control, despite the uncertainties that come with the disease. For many individuals diagnosed with FA, the psychological toll begins early. The routine of medical appointments, therapies, and the possibility of major procedures, such as bone marrow transplants, can cause stress, anxiety, and depression. Developing healthy coping mechanisms is essential to manage these emotional stressors. Mindfulness practices, counseling, and expressive therapies, such as journaling or art, can provide outlets for processing difficult emotions. These strategies help individuals stay grounded and foster emotional stability. Social support plays a central role in coping with chronic illness. Having a strong network of family, friends, and healthcare providers can make a meaningful difference in a patient's experience. Support groups, whether in person or online, offer opportunities to connect with others facing similar challenges. These communities can be a source of comfort, offering shared understanding, practical advice, and encouragement during times of hardship. Maintaining a sense of autonomy and normalcy is also vital. Chronic illness often creates feelings of helplessness or loss of control, especially when daily life is interrupted by medical needs. Empowering patients to take an active role in their care, such as setting goals, asking questions, and participating in treatment decisions, can help restore a sense of control. Engaging in hobbies, education, or light physical activity, when possible, can help individuals maintain a sense of identity beyond their diagnosis. For parents and caregivers, coping involves balancing care responsibilities with their own emotional health. Caregiver fatigue and burnout are common, so it's important for them to seek support and take time for self-care. Professional mental health support and respite care services can provide essential relief and guidance for long-term caregiving. Ultimately, coping with a chronic illness like Fanconi anemia is not a one-size-fits-all journey. Each individual finds their own path, shaped by their personality, circumstances, and support system. Encouraging open communication, emotional expression, and mental health awareness within the care plan can greatly enhance quality of life and foster resilience in the face of FA's many challenges. Support systems and resources. For individuals and families affected by Fanconi anemia, FA, support systems and access to reliable resources are essential components of managing the condition. Because FA is a rare genetic disorder, many patients and caregivers face a unique set of challenges that can be difficult to navigate without guidance. The right support, both emotional and practical, can make a significant difference in improving quality of life and ensuring continuity of care. Support systems often begin within the home. Family members, caregivers, and close friends provide the primary foundation of emotional support. They help manage day-to-day responsibilities, attend medical appointments, and offer comfort during difficult times. This close-knit network becomes particularly important when facing decisions about treatment options, hospital stays, or long-term care planning. Encouraging open communication within these relationships strengthens trust and helps ease the emotional burden for everyone involved. Healthcare teams also form a crucial part of the support system. Doctors, nurses, genetic counselors, psychologists, and social workers contribute expertise and provide holistic care. Working collaboratively with a multidisciplinary team ensures that all aspects of the patient's needs, medical, emotional, and developmental, are addressed. Access to knowledgeable and compassionate healthcare professionals can empower families and give them the confidence to make informed decisions. Outside the clinical setting, patient advocacy groups and nonprofit organizations dedicated to Fanconi anemia offer a wealth of resources. These organizations often provide educational materials, updates on research and treatment advances, access to specialists, and connections to support groups. Families can benefit from learning about their rights, available financial aid, and options for clinical trial participation. For example, the Fanconi Anemia Research Fund, FARF, is a leading organization offering extensive information and community connections to families worldwide. Support groups, whether virtual or in person, give individuals the chance to connect with others who understand the daily challenges of living with FA. These groups provide a safe space to share experiences, exchange practical advice, and offer emotional encouragement. Connecting with others who are going through similar struggles can help reduce feelings of isolation and foster a sense of belonging. Access to resources and strong support systems can improve not only the patient's health outcomes, but also the emotional resilience of their entire family. Whether through medical guidance, advocacy, or personal connections, these systems remind individuals that they are not alone in their journey. Leveraging these resources ensures that individuals and families affected by Fanconi anemia are equipped to face the challenges ahead with strength, knowledge, and community. Psychological support for families. Fanconi anemia is not only a medical diagnosis, it is a life-changing event for entire families. The psychological toll of coping with a rare, life-threatening condition can be overwhelming, particularly when it affects a child. Families often experience a range of emotions including grief, fear, guilt, anxiety, and uncertainty. Because of this, psychological support is a critical aspect of comprehensive care that should not be overlooked. From the moment of diagnosis, families are faced with an entirely new reality. Parents may struggle with feelings of guilt, wondering if they passed on the condition genetically, while simultaneously trying to remain strong and hopeful for their child. Siblings may feel neglected or confused by the sudden shift in family dynamics. Extended family members may want to help, but may not know how. In these moments, access to professional psychological support can help individuals and families understand, process, and express their emotions in a healthy way. Therapists and counselors who specialize in chronic illness and pediatric care can offer tailored approaches to help each family member cope. Individual counseling for the patient, parent, or siblings can address specific emotional challenges. Family therapy sessions can improve communication, strengthen relationships, and create a safe space to express fears and frustrations. Support groups for parents of children with rare diseases also offer shared understanding and collective strength, which can be especially valuable during periods of intense stress. Educational psychologists can assist children with FA in navigating academic challenges and social integration, especially when frequent hospital visits disrupt schooling. Social workers often help families manage logistical burdens, including financial concerns, insurance questions, and resource navigation, all of which can indirectly impact mental well-being. Another vital form of psychological support involves helping families cultivate resilience. Resilience training can teach practical coping mechanisms, stress reduction techniques, and emotional regulation. These skills are critical for long-term emotional health, especially in a condition like FA that may involve lifelong care and periodic medical crises. Psychological support must be an ongoing effort, not a one-time intervention. Emotional needs evolve over time as the child grows, treatments progress, or new challenges arise. Proactively integrating mental health care into the broader treatment plan allows families to feel heard, supported, and empowered rather than overwhelmed and isolated. Ultimately, supporting the psychological health of the entire family is key to ensuring the best possible outcomes, not just medically, but emotionally. When families are emotionally healthy, they are better equipped to provide stability, love, and strength for their loved one facing Fanconi anemia. Chapter 8: The Future of Fanconi Anemia Care. As research progresses and technology advances, the future of Fanconi anemia, FA care is becoming increasingly hopeful. What was once a poorly understood and devastating condition is now the focus of cutting-edge science, multidisciplinary treatment strategies, and global collaboration. The goal is no longer just to manage symptoms, but to transform outcomes through earlier detection, more effective therapies, and ultimately a cure. One of the most promising areas is the ongoing development of gene therapy. Scientists are working toward correcting the faulty genes responsible for FA by inserting healthy copies into a patient's cells. Early-stage trials have already demonstrated encouraging results, showing the potential to reduce bone marrow failure and delay the onset of complications. As techniques improve, gene therapy could move from experimental to standard care, especially for patients without a matched bone marrow donor. Personalized medicine also offers great potential. By understanding the unique genetic makeup of each individual, clinicians can tailor treatments that are more effective and less harmful. This includes targeted therapies that minimize damage to healthy cells, particularly important for FA patients who are highly sensitive to chemotherapy and radiation. With precision medicine, the hope is to increase survival rates while improving quality of life. In the realm of diagnostics, advancements in early detection methods are expected to lead to faster and more accurate diagnoses. This includes expanded newborn screening protocols, non-invasive genetic testing, and integration of artificial intelligence to identify FA-related patterns. Earlier diagnosis allows for better planning, timely treatment, and reduced complications. The future also includes a stronger emphasis on long-term care and survivorship. As more individuals with FA live into adulthood, there is a growing need for comprehensive adult care programs. These programs address late-onset complications such as cancer risk, organ damage, and fertility challenges. Integrating adult specialists into the care team ensures continuity and supports quality of life throughout the lifespan. Beyond medical advances, future care will be shaped by increased awareness, policy support, and advocacy. Patient organizations, caregivers, and researchers continue to push for more funding, inclusive clinical trials, and equitable access to care across regions. Digital platforms and telemedicine are also expanding the reach of FA care to underserved communities, bridging geographical gaps. While challenges remain, the trajectory of Fanconi anemia care is undeniably forward-moving. With continued research, innovation, and compassion, the future offers not just better treatment, but the possibility of transformative change for those living with FA. Advancements in genetic research. Genetic research has played a central role in unraveling the complex nature of Fanconi anemia, FA, and recent advancements continue to shed light on its underlying mechanisms, potential treatments, and long-term management. These developments are helping to transition FA from a largely fatal diagnosis to a more manageable condition, with new possibilities for early intervention and even potential cures. One of the most significant advancements has been the identification and understanding of the FANC gene family, which is directly involved in DNA repair pathways. Researchers have now cataloged over 20 genes linked to FA, and ongoing studies continue to reveal how mutations in these genes disrupt the body's ability to repair damaged DNA. This knowledge has led to the refinement of diagnostic tools and deeper insight into why FA patients are prone to bone marrow failure and cancer. The development of CRISPR-Cas9 gene editing technology has opened new possibilities for correcting genetic mutations at the source. While still largely in the research phase, scientists are exploring ways to use CRISPR to precisely repair faulty FANC genes in a patient's own cells. Such corrections could restore normal function and potentially eliminate the need for bone marrow transplants. While challenges remain in terms of delivery and safety, early studies in laboratory models are showing promise. Another exciting area of advancement is the use of induced pluripotent stem cells, iPSCs. These are adult cells that have been reprogrammed to behave like embryonic stem cells, which can then be used to model FA in the lab. By observing how FA-affected cells develop and function, researchers can test new drugs and therapeutic strategies with greater accuracy. iPSC models are also helping scientists understand why certain mutations lead to more severe symptoms than others. Genetic research has also helped improve prenatal and preimplantation genetic diagnosis. Parents with a known risk of passing on FA can now access more precise testing options to identify carriers and plan family-building choices accordingly. This kind of foresight allows for earlier intervention and can reduce the emotional and medical burden for families. As data sharing and global collaboration increase, the pace of discovery continues to accelerate. Biobanks and international registries allow researchers to study rare mutations across broader populations, increasing the chances of breakthroughs. These advancements not only deepen scientific understanding, but also provide hope for more effective treatments and eventually a definitive cure. The growing body of genetic research holds the potential to transform the FA landscape, offering new pathways toward targeted, personalized, and lasting solutions. Potential for personalized medicine. Personalized medicine is emerging as a transformative approach in the care of individuals with Fanconi anemia, FA, offering the possibility of treatments that are tailored to the unique genetic and clinical profile of each patient. As our understanding of the genetic diversity within FA deepens, so too does the opportunity to develop more targeted and effective interventions. Fanconi anemia is caused by mutations in one of over 20 different FANC genes, and each mutation can affect patients in distinct ways. Some may develop severe bone marrow failure in early childhood, while others might live into adulthood before experiencing symptoms. Personalized medicine aims to take these differences into account, using genetic information to customize treatment plans that are more precise and potentially more effective. One of the primary ways personalized medicine is impacting FA care is through individualized risk assessment. By identifying the exact gene mutation responsible for a patient's condition, clinicians can better predict the severity of the disease and the likelihood of complications such as cancer or organ damage. This knowledge helps guide decisions about monitoring, treatment intensity, and long-term planning. Drug response is another area where personalized medicine shows promise. Because FA patients are highly sensitive to certain medications, including chemotherapy, understanding an individual's genetic makeup can help avoid drugs that may cause harmful side effects. Research is underway to develop therapies that target specific molecular pathways disrupted by different FANC mutations. These targeted treatments could improve outcomes while minimizing toxicity. Personalized approaches are also being explored in bone marrow transplantation, one of the most common treatments for FA. Advances in donor matching, conditioning regimens, and graft manipulation are increasingly being tailored to each patient's genetic background and immune profile, improving transplant success and reducing complications like graft versus host disease. Gene therapy is another frontier where personalization is key. Emerging techniques allow for the correction of specific mutations within a patient's own cells, offering a potential cure that is uniquely suited to the individual's genetic structure. Although these therapies are still in development, they reflect the future of FA treatment, individualized, effective, and potentially life-saving. Ultimately, the potential of personalized medicine lies in its ability to shift FA care from a one-size-fits-all model to one that is more adaptive and nuanced. By aligning treatment strategies with the patient's unique genetic and clinical information, personalized medicine opens the door to more hopeful, efficient, and humane care for those living with Fanconi anemia. Global efforts in advocacy and awareness. The global response to Fanconi anemia, FA, has grown significantly over the past few decades, driven by the dedication of patient advocacy groups, research institutions, and healthcare professionals. As a rare genetic disorder, FA requires coordinated international efforts to raise awareness, promote early diagnosis, support families, and drive research forward. Advocacy plays a vital role in ensuring that individuals affected by FA are not left behind in the broader medical landscape. Patient advocacy organizations have been at the heart of these efforts. Groups such as the Fanconi Anemia Research Fund in the United States and similar organizations in Europe, Asia, and Latin America have worked tirelessly to connect families, fund scientific studies, and push for advancements in care. These organizations provide critical resources, from educational materials to emotional support networks, that help patients and caregivers navigate the challenges of life with FA. One of the most impactful aspects of global advocacy has been the promotion of international collaboration in research. Because FA is so rare, no single country has enough patients to conduct large-scale clinical trials or gather comprehensive data on disease progression. International consortia, biobanks, and collaborative registries allow scientists to pool data, share findings, and accelerate discovery. These collaborations have led to the identification of additional FA genes and the development of more precise diagnostic tools. Awareness campaigns also play a key role. Through social media, fundraising events, and educational conferences, advocates work to inform both the public and medical professionals about the signs and risks of FA. This is especially important in regions where FA may be underdiagnosed or misunderstood. Early recognition of symptoms can lead to faster diagnosis, better management, and improved quality of life. Efforts to influence policy have also emerged as a significant component of advocacy. Many organizations are working to ensure that patients with FA have access to genetic testing, specialized treatments, and financial assistance. These efforts include lobbying governments, collaborating with health ministries, and engaging with the pharmaceutical industry to improve the affordability and availability of essential therapies. Despite the challenges, global advocacy for FA continues to gain momentum. The shared mission of improving lives through awareness, research, and support has created a strong, resilient community. As advocacy networks expand and awareness grows, more patients will receive timely diagnoses, more researchers will be drawn to study FA, and the collective voice for progress will become even stronger across the globe. Conclusion. Fanconi anemia, FA, stands as a uniquely complex genetic disorder that continues to challenge patients, families, and medical professionals alike. With its roots in inherited DNA repair deficiencies, FA manifests through a wide range of physical, hematological, and oncological complications. Over the years, tremendous progress has been made in understanding the disease at a molecular level, improving diagnostic tools, and developing more effective treatments such as bone marrow transplantation and supportive therapies. Yet despite these advancements, significant gaps remain in both care and research. The growing body of knowledge around FA has been the result of tireless efforts by scientists, clinicians, and global advocacy organizations. Their work has highlighted the importance of early detection, the promise of gene therapy, and the potential of personalized medicine in transforming patient outcomes. As research expands and technologies advance, the vision of a future where FA is manageable or even curable becomes increasingly realistic. Equally important are the psychological, social, and emotional aspects of living with FA. Families face not only the physical realities of the disease, but also the emotional toll of chronic illness, uncertainty, and long-term care planning. Addressing these challenges requires more than medical innovation. It calls for a holistic approach that includes mental health support, social services, and strong community networks. The global FA community continues to be a powerful force in pushing the boundaries of what is possible. Advocacy groups, patients, and researchers have created an international network that fosters hope, shares information, and ensures that FA remains a visible priority in rare disease conversations. Their collective voice has helped shape policy, secure funding, and generate public awareness that benefits both current and future generations of those affected. As we look ahead, the path forward lies in sustained research, continued collaboration, and a commitment to holistic care. Each step taken toward understanding the genetic intricacies of FA or developing innovative treatment strategies represents a step toward a better future. While the battle against Fanconi anemia is far from over, the momentum built by decades of research and advocacy provides a strong foundation for the breakthroughs still to come. In conclusion, Fanconi anemia is more than a rare disease. It is a global challenge met with resilience, determination, and hope. Through continued effort and unity, there is every reason to believe that the story of FA will become one of ongoing progress and eventual triumph.
Chapter 1: Understanding Sickle Cell Anemia. Sickle cell anemia is a hereditary blood disorder that affects the shape and function of red blood cells. In a healthy individual, red blood cells are round and flexible, allowing them to move easily through blood vessels. However, in someone with sickle cell disease, the cells become rigid, sticky, and shaped like crescent moons or sickles. These misshapen cells tend to clump together, blocking blood flow and leading to a variety of painful and serious complications. The root cause of sickle cell anemia lies in a genetic mutation that affects hemoglobin, the protein in red blood cells that carries oxygen. The disorder is inherited when a child receives two sickle cell genes, one from each parent. If only one gene is inherited, the child has sickle cell trait, which usually doesn't cause symptoms but can be passed on to offspring. The disease is more common in people of African, Mediterranean, Middle Eastern, and Indian ancestry, but it can affect individuals from all backgrounds. There are different forms of the disease, with hemoglobin SS being the most severe. Others, like hemoglobin SC or S-beta thalassemia, tend to have milder symptoms but can still significantly impact health. Understanding these variations is crucial for patients and their families, as each type may require a different approach to management and care. Recognizing the basics of sickle cell anemia is the first step in learning how to cope with it. This chapter lays the foundation for what follows: insights into living with the condition, addressing its challenges, and ultimately finding strength and resilience in the face of a lifelong struggle. What is sickle cell disease? Sickle cell disease, SCD, is a group of inherited blood disorders that primarily affect the structure and function of red blood cells. At the heart of the disease is an abnormal form of hemoglobin known as hemoglobin S, which causes red blood cells to assume a rigid, sickle, or crescent shape instead of their usual soft, round form. This change in shape has profound consequences on how the blood cells move through the body and deliver oxygen to tissues and organs. Under normal conditions, red blood cells are flexible and can easily flow through the smallest blood vessels, efficiently transporting oxygen from the lungs to all parts of the body. In people with SCD, the sickle-shaped cells are not only less efficient at carrying oxygen, but they are also sticky and prone to clumping. These clumps can obstruct blood flow, causing pain, inflammation, and damage to vital organs. Over time, this leads to complications such as stroke, acute chest syndrome, kidney failure, and chronic pain. Sickle cell disease is a genetic condition, meaning it is passed from parents to their children through their genes. For a person to have the disease, they must inherit 2 copies of the sickle cell gene, one from each parent. If they inherit only 1 copy, they have what is called sickle cell trait, which usually doesn't cause symptoms but means they are carriers of the gene and can pass it on to their children. The disease is more commonly found in individuals of African, Mediterranean, Middle Eastern, and South Asian descent, though it can affect people from any ethnic background. There are several different types of SCD, with the most severe being hemoglobin SS, also known as sickle cell anemia. Other forms include hemoglobin SC and S-beta thalassemia, which vary in severity and symptoms. Regardless of type, people with SCD face a lifelong journey of managing the disease, preventing complications, and maintaining as much normalcy as possible. Thanks to advancements in medical care and increased awareness, many people with sickle cell disease now live longer and more fulfilling lives than ever before. Early diagnosis through newborn screening, access to specialized care, and consistent treatment can greatly improve quality of life. Understanding what sickle cell disease is, how it affects the body, and how it is inherited is an essential step toward breaking stigma, supporting those affected, and driving continued progress in treatment and advocacy. Genetic causes and inheritance patterns. Sickle cell disease is a genetic disorder that arises from a mutation in the gene responsible for producing hemoglobin, the oxygen-carrying protein in red blood cells. The genetic mutation causes the creation of an abnormal form of hemoglobin called hemoglobin S. This mutation alters the structure of red blood cells, causing them to bend and form a characteristic sickle shape under certain conditions, which in turn disrupts their normal function. The change in cell shape is due to a single amino acid substitution in the beta-globin chain of hemoglobin, making this disorder a classic example of a point mutation. The inheritance pattern of sickle cell disease is autosomal recessive, meaning that an individual needs to inherit 2 copies of the mutated gene, one from each parent, to exhibit the full-blown disease. If a person inherits only 1 copy of the mutation, they are considered carriers and have what is known as sickle cell trait. Carriers usually do not experience the severe symptoms associated with the disease, but can pass the mutated gene on to their children. When 2 carriers have a child, there is a 25% chance that the child will inherit 2 copies of the mutated gene, a 50% chance that the child will be a carrier, and a 25% chance that the child will inherit 2 normal genes. The prevalence of the mutated gene is higher in certain regions of the world, particularly in areas where malaria has been endemic, such as sub-Saharan Africa, the Mediterranean basin, the Middle East, and parts of India. This geographical distribution is linked to a survival advantage provided to carriers in malaria-infested regions, as the presence of one mutated gene appears to confer some protection against the most severe forms of malaria. Over generations, this selective pressure has led to a higher frequency of the sickle cell gene in these populations. Modern genetic counseling plays a critical role in helping individuals and families understand the risks of transmitting the gene to their offspring. It includes education about the nature of the mutation, discussions of family history, and analysis of genetic testing results. Through informed decision-making, carriers and affected individuals can better navigate reproductive choices. Understanding the genetic causes and inheritance patterns of sickle cell disease is fundamental in the broader context of managing and treating the disorder, as it underpins the strategies for early detection, prevention, and the future development of gene-based therapies. Types and variants of the disease. Sickle cell disease is not a single condition, but rather a group of related blood disorders caused by inherited mutations affecting hemoglobin. While all forms of the disease involve some level of abnormal hemoglobin and sickle-shaped red blood cells, the specific type and severity of symptoms can vary significantly depending on the particular genetic combination inherited. Understanding the types and variants of sickle cell disease is essential for accurate diagnosis, effective treatment planning, and personalized care. The most common and severe form is hemoglobin SS, also known simply as sickle cell anemia. In this form, a person inherits two sickle cell genes, one from each parent. Hemoglobin SS leads to the most frequent and intense symptoms, including severe pain episodes, chronic anemia, organ damage, and a higher risk of infections and other complications. People with hemoglobin SS often require more intensive medical management from an early age. Another variant is hemoglobin SC disease, where a person inherits one sickle cell gene and one gene for hemoglobin C, a different abnormal hemoglobin. While hemoglobin SC can still cause significant health problems, the symptoms tend to be milder than those seen in hemoglobin SS. Individuals may experience fewer pain crises and a lower risk of severe complications, although the disease still requires careful monitoring and treatment. Hemoglobin S beta thalassemia is another major form, and it results from inheriting one sickle cell gene and one gene for beta thalassemia, a condition that reduces the production of normal hemoglobin. This variant has two main subtypes: S beta thalassemia, in which little or no normal hemoglobin is produced, and S beta thalassemia, where some normal hemoglobin is still made. S beta thalassemia often resembles hemoglobin SS in severity, while S beta thalassemia can be milder. The severity of symptoms depends on the amount of normal hemoglobin the body is able to produce. There are also rare combinations involving other abnormal hemoglobins, such as hemoglobin SD, SE, and SO-Arab, which can lead to variable symptoms. These forms are less common but can still present serious health challenges. Each type of sickle cell disease affects individuals differently, and even among those with the same variant, experiences can vary widely. This variability makes it important for healthcare providers to tailor treatment to each patient's specific condition. Advances in genetic testing and disease monitoring continue to improve our ability to understand and manage these different variants, offering greater hope for individuals living with sickle cell disease. Chapter 2: Early Diagnosis and Symptoms. Early diagnosis of sickle cell disease is critical in managing the condition and preventing complications before they become life-threatening. In many countries, especially those with advanced healthcare systems, newborn screening programs are in place to detect sickle cell disease shortly after birth. This early identification allows for prompt medical intervention, education for the family, and the development of a treatment plan to support the child's health from infancy. The first symptoms of sickle cell disease often appear within the first few months of life, typically around 5 to 6 months of age. Before this age, infants are usually protected by fetal hemoglobin, which does not sickle. As the body starts producing adult hemoglobin, symptoms begin to emerge. One of the earliest signs is dactylitis, or swelling of the hands and feet, which occurs due to blocked blood flow in the small bones. This painful condition can be alarming to parents, but is often the first clue that a child has the disease. As children grow, other symptoms begin to manifest. Chronic anemia is a hallmark of sickle cell disease. Because sickled red blood cells are fragile and break down prematurely, the body struggles to maintain a sufficient supply of healthy red blood cells. This can result in fatigue, pallor, and delayed growth and development in children. Frequent infections are also common, especially in young children, because the spleen, an organ crucial to fighting infection, is often damaged by sickled cells early in life. This makes children with sickle cell disease more vulnerable to illnesses that a healthy immune system would typically manage. Another defining symptom is the occurrence of pain crises, or vaso-occlusive episodes. These are sudden, intense pains caused by sickled cells, blocking blood flow to specific parts of the body. The pain can range from mild to excruciating and often requires medical intervention. These episodes can occur in the bones, chest, abdomen, and joints, and may last for hours or even days. Other early symptoms and complications may include jaundice, caused by the rapid breakdown of red blood cells, and an enlarged spleen or liver. If left untreated, these complications can progress, leading to more serious issues such as stroke, acute chest syndrome, or organ damage. Recognizing these early symptoms and ensuring timely diagnosis can significantly improve the quality of life for children with sickle cell disease. With proper medical support, education, and lifestyle adjustments, many individuals with the condition can go on to live healthy and fulfilling lives. Recognizing early signs in children. Identifying the early signs of sickle cell disease in children is crucial for timely intervention and ongoing care. Most children with the disease appear healthy at birth, and symptoms typically do not manifest until they are several months old. This is because newborns have a high level of fetal hemoglobin, which protects their red blood cells from sickling. However, as the body begins to produce adult hemoglobin, the protective effect diminishes and symptoms start to appear. One of the earliest and most common signs of sickle cell disease in infants is dactylitis, or painful swelling in the hands and feet. This occurs when sickled red blood cells block blood flow to the small bones of the hands and feet, causing inflammation and pain. Dactylitis may be mistaken for an injury or infection, but it often appears without any obvious cause and is a key indicator of the disease in young children. Another early symptom is persistent fatigue. Children with sickle cell disease often experience anemia due to the rapid breakdown of sickled red blood cells. This chronic shortage of healthy red blood cells can result in noticeable tiredness, decreased activity levels, and general weakness. A child may struggle to keep up with peers and physical activities, or seem unusually tired after mild exertion. Yellowing of the skin and eyes, known as jaundice, is another common early sign. This occurs because the liver becomes overwhelmed by the constant breakdown of red blood cells, leading to a buildup of bilirubin in the body. Parents may notice that their child's eyes have a yellow tint or that their skin appears slightly yellowish, especially during or after a pain crisis. Frequent infections, particularly in the early years, may also indicate sickle cell disease. The spleen, which plays a critical role in filtering bacteria and fighting infection, is often one of the first organs affected by the disease. Damage to the spleen can make children more susceptible to serious infections, including pneumonia and meningitis, which can develop rapidly and require immediate medical attention. Monitoring these early signs allows for prompt medical care and the initiation of preventive measures such as vaccinations, antibiotics, and parental education. Early recognition of symptoms not only improves immediate outcomes, but also sets the foundation for better long-term health and quality of life. With attentive care and early treatment, many children with sickle cell disease can manage their symptoms and thrive. Diagnostic tests and screening methods. Diagnosing sickle cell disease involves specialized tests that detect the presence of abnormal hemoglobin in the blood. Early and accurate diagnosis is essential to ensure that individuals receive timely medical care and support. In many countries, newborn screening programs have made it possible to detect sickle cell disease within days of birth, greatly improving outcomes for affected infants. The primary method used in newborn screening is a blood test known as hemoglobin electrophoresis. This test analyzes the types of hemoglobin in the blood and can identify the presence of hemoglobin S, the abnormal form responsible for sickle cell disease. A few drops of blood are usually collected from the baby's heel and sent to a laboratory for testing. If abnormal hemoglobin is found, confirmatory testing is performed to establish a clear diagnosis. High-performance liquid chromatography, HPLC, is another precise method used to separate and measure different types of hemoglobin. This test is often used alongside or instead of electrophoresis for confirmation. It is highly sensitive and can distinguish between the various forms of sickle cell disease, such as hemoglobin SS, SC, or S-beta thalassemia, as well as differentiate between sickle cell disease and sickle cell trait. Isoelectric focusing is another laboratory technique used to identify abnormal hemoglobin variants. It works by separating proteins based on their electric charge and provides detailed information about the types of hemoglobin present in a sample. This method is especially useful in newborn screening programs and in laboratories with access to advanced diagnostic tools. For older children and adults, a complete blood count, CBC, and peripheral blood smear can provide clues pointing to sickle cell disease. These tests may reveal signs such as low red blood cell counts, variations in cell size, and the presence of sickle-shaped cells. While these tests alone cannot confirm the disease, they often prompt further investigation. Genetic testing is also available and can identify mutations in the HBB gene that cause sickle cell disease. This is particularly helpful for confirming a diagnosis in ambiguous cases or for carrier testing in individuals planning to have children. Genetic counseling is often recommended alongside testing to help individuals understand the results and their implications. Screening and diagnostic testing are vital not only for identifying the disease, but also for enabling early intervention. With a confirmed diagnosis, families can work with healthcare providers to establish a treatment plan, monitor for complications, and take preventive steps that can improve quality of life and long-term health outcomes. Differentiating sickle cell from other disorders. Sickle cell disease shares symptoms with a number of other blood and genetic disorders, which can sometimes make initial diagnosis challenging. Distinguishing it from these conditions is essential for providing the correct treatment and management plan. Many of the early symptoms, such as fatigue, pain, anemia, and frequent infections, are common to other diseases, so a detailed evaluation using specific diagnostic tests is necessary. One of the most closely related conditions is thalassemia, another inherited blood disorder affecting hemoglobin. Both diseases result in anemia and abnormal red blood cells, but the underlying genetic mutations differ. Thalassemia typically causes red blood cells to be smaller and paler than normal, and leads to ineffective production of hemoglobin. In contrast, sickle cell disease is characterized by red blood cells that assume a rigid crescent shape and have a tendency to block blood vessels. Hemoglobin electrophoresis, or high-performance liquid chromatography, can accurately differentiate between these two conditions by identifying the specific type of abnormal hemoglobin present. Iron deficiency anemia is another disorder that may mimic some symptoms of sickle cell disease, such as fatigue and pallor. However, iron deficiency results from low iron levels in the body, rather than a genetic mutation. A complete blood count, serum ferritin levels, and iron studies can help distinguish iron deficiency anemia from sickle cell disease. In sickle cell patients, iron levels are usually normal or elevated, especially in those who have received frequent blood transfusions. Autoimmune diseases like lupus or juvenile idiopathic arthritis can also cause joint pain, fatigue, and episodes of inflammation, which are symptoms that overlap with those of sickle cell disease. However, these conditions involve immune system dysfunction and are not related to hemoglobin abnormalities. Blood tests that assess immune markers and the presence of autoantibodies are used to identify autoimmune conditions and exclude sickle cell disease as the cause of symptoms. Infections and certain types of cancer, such as leukemia, can also present with anemia and fatigue. A thorough patient history, physical examination, and targeted lab tests help distinguish these conditions. Sickle cell disease is unique in its inheritance pattern, red blood cell morphology, and the presence of hemoglobin S, making confirmatory testing crucial. Differentiating sickle cell disease from other disorders relies heavily on the use of specialized diagnostic tests and an understanding of each condition's clinical presentation. Accurate diagnosis ensures that patients receive the appropriate care, reducing the risk of complications and improving their overall prognosis. Chapter 3: The Physical Impact on the Body. Sickle cell disease affects nearly every system in the body due to the abnormal shape and function of red blood cells. These cells, when sickled, are rigid and sticky, making it difficult for them to pass smoothly through small blood vessels. As a result, they can obstruct blood flow and reduce oxygen delivery to tissues and organs. Over time, this leads to a range of physical complications, some of which can be life-threatening if not properly managed. One of the most common and painful consequences of sickle cell disease is the vaso-occlusive crisis. These pain episodes occur when sickled cells block blood flow in tiny vessels, causing tissue damage and inflammation. Pain can affect the bones, chest, abdomen, and joints, and can be either acute or chronic. For many individuals, this is the most visible and disabling aspect of the disease, often requiring hospitalization and strong pain management strategies. Chronic anemia is another hallmark of the disease. Sickled red blood cells have a much shorter lifespan than healthy ones, about 10 to 20 days compared to the normal 120 days. This constant turnover leads to a shortage of red blood cells, causing symptoms such as fatigue, weakness, shortness of breath, and a pale appearance. Over time, anemia can affect physical development in children and overall stamina in adults. Organ damage is a serious long-term consequence. The spleen is usually one of the first organs to be affected, as it filters blood and removes damaged cells. Repeated blockages can lead to a condition known as autosplenectomy, where the spleen essentially destroys itself. This increases vulnerability to infections. The liver and kidneys are also at risk. The liver may become enlarged or dysfunctional due to excess breakdown of red cells, while the kidneys can suffer damage from reduced oxygen and blood flow, sometimes leading to chronic kidney disease. The lungs and heart are not spared. Acute chest syndrome, a dangerous condition marked by chest pain, fever, and difficulty breathing, is caused by sickled cells blocking blood flow in the lungs. It is one of the leading causes of death among people with sickle cell disease. Over time, the heart may enlarge and struggle to compensate for chronic anemia, increasing the risk of heart failure. The cumulative effects of sickle cell disease on the body underscore the importance of comprehensive, lifelong care. Regular checkups, preventive treatments, and early intervention are key to minimizing the physical toll and improving the quality and length of life for those living with this condition. Pain crises and their triggers. Pain crises, also known as vaso-occlusive episodes, are one of the most debilitating and frequent complications of sickle cell disease. These episodes occur when sickled red blood cells block blood flow through tiny blood vessels, preventing oxygen from reaching tissues and causing intense pain. The severity, frequency, and duration of pain crises can vary widely from person to person, but for many individuals, they are a defining and life-altering aspect of living with the condition. The pain experienced during a crisis can strike suddenly and may last from a few hours to several days. It commonly affects the bones, joints, chest, and abdomen, but virtually any part of the body can be involved. For some individuals, the pain is manageable at home with over-the-counter medications and rest. For others, the pain is so severe that hospitalization and the use of strong pain relievers like opioids become necessary. Repeated episodes over time can also lead to chronic pain, even between crises, due to ongoing damage to bones and joints. Understanding what triggers pain crises is essential for prevention and management. Dehydration is a common trigger because it leads to reduced blood volume and increased blood viscosity, making it easier for sickled cells to clump together and obstruct vessels. Staying well hydrated is one of the simplest but most effective preventive strategies. Temperature extremes, particularly exposure to cold, can also prompt a crisis. Cold temperatures cause blood vessels to constrict, increasing the risk of blockage by sickled cells. Similarly, sudden changes in temperature, such as moving from a hot environment to an air-conditioned space, can have the same effect. Individuals with sickle cell disease are often advised to dress warmly and avoid rapid temperature changes. Infections are another major trigger. When the body is fighting off an illness, it enters a state of increased inflammation, which can exacerbate the sickling of red blood cells. Even common infections like the flu or a cold can provoke a pain crisis, making immunizations and prompt treatment of illnesses a crucial part of care. Other potential triggers include physical overexertion, stress, and lack of sleep. All of these factors can place added strain on the body and contribute to the sickling process. In some cases, the cause of a crisis remains unclear, highlighting the unpredictable nature of the disease. Effective management of pain crises includes preventive strategies, patient education, and timely medical intervention. By understanding and avoiding common triggers, individuals with sickle cell disease can reduce the frequency and severity of pain episodes, leading to a better quality of life. Organ damage and long-term effects. Sickle cell disease is a chronic condition that causes widespread damage to the body over time, largely due to the recurring blockage of blood flow by sickled red blood cells. These blockages reduce the oxygen supply to tissues and organs, leading to gradual deterioration and, in many cases, permanent damage. While acute symptoms like pain crises are the most visible aspects of the disease, the long-term effects on vital organs are equally, if not more, serious. The spleen is often the first organ affected. In healthy individuals, the spleen filters bacteria and helps fight infections. In people with sickle cell disease, sickled cells can clog the blood vessels within the spleen, causing repeated mini-strokes in the tissue. This leads to a condition known as autosplenectomy, where the spleen shrinks and loses its function. Without a working spleen, individuals are far more susceptible to infections, particularly from bacteria like Streptococcus pneumoniae. The lungs are also commonly impacted. Recurrent blockages can lead to acute chest syndrome, a life-threatening condition that resembles pneumonia and includes symptoms such as chest pain, fever, and difficulty breathing. Over time, repeated episodes can scar lung tissue and cause chronic lung disease. Pulmonary hypertension or high blood pressure in the lungs is another long-term consequence that can develop and place added strain on the heart. The heart itself is not immune to the effects of sickle cell disease. Chronic anemia forces the heart to work harder to supply oxygen to the body, often resulting in an enlarged heart. Over time, this can lead to complications such as heart failure. The constant stress on the cardiovascular system also raises the risk of stroke, particularly in children with the disease. Transcranial Doppler screenings are often used to assess stroke risk in children and initiate preventive treatments when needed. The kidneys are highly sensitive to changes in blood flow and oxygen levels. In sickle cell disease, repeated episodes of ischemia can impair kidney function. Over time, this can result in chronic kidney disease or even kidney failure. Signs of kidney damage may begin with protein in the urine and progress silently, making regular monitoring essential. The liver, eyes, and bones are other organs that may suffer long-term damage. Chronic hemolysis, the constant breakdown of red blood cells, can overload the liver, while blockages in tiny vessels of the eyes can lead to vision problems or blindness. Bone tissue, deprived of oxygen, can weaken and break down, sometimes leading to a painful condition called avascular necrosis. The cumulative damage from sickle cell disease requires comprehensive, long-term medical care. Early detection and proactive management are key to preserving organ function and improving life expectancy for individuals living with this complex disorder. Complications from infections and anemia. Infections and anemia are two of the most serious and persistent complications faced by individuals living with sickle cell disease. Both are closely tied to the underlying issues caused by the sickling of red blood cells and have a profound impact on overall health. Together, they contribute significantly to the chronic nature of the disease and its long-term consequences. People with sickle cell disease are especially vulnerable to infections due to the early loss of spleen function. The spleen plays a critical role in filtering bacteria and supporting the immune system. When sickled cells repeatedly block the blood vessels within the spleen, it eventually becomes non-functional, a condition called autosplenectomy. Without a working spleen, the body struggles to fight off bacterial infections, making individuals more susceptible to life-threatening illnesses such as pneumonia, meningitis, and sepsis. Infants and young children are particularly at risk, which is why preventive care begins early with routine vaccinations and prophylactic antibiotics like penicillin. Even common infections can rapidly become severe in people with sickle cell disease. Fever, often a sign of infection, requires immediate medical attention, as delays in treatment can lead to rapid deterioration. Viral infections, including the flu or even a common cold, can also provoke pain crises or worsen anemia. Because of this, annual flu vaccines and careful infection control practices are strongly encouraged for all patients. Anemia is another core complication of sickle cell disease. Unlike normal red blood cells, which live for about 120 days, sickled red cells break down after only 10 to 20 days. The body cannot keep up with the demand to produce new cells, leading to a constant state of anemia. This chronic shortage of red blood cells reduces the amount of oxygen delivered to tissues, resulting in fatigue, weakness, shortness of breath, and delayed growth in children. In severe cases, it can lead to heart problems and increased risk of stroke. In addition to chronic anemia, individuals may experience sudden drops in hemoglobin levels due to complications such as aplastic crises or splenic sequestration. Aplastic crises are often triggered by infections like parvovirus B19, which temporarily halt red blood cell production. Splenic sequestration occurs when large volumes of blood become trapped in the spleen, causing it to enlarge rapidly and leading to a dangerous drop in circulating blood volume. Both conditions are medical emergencies and require urgent treatment. Managing these complications involves a proactive approach that includes regular medical monitoring, early treatment of infections, and sometimes blood transfusions to boost red cell levels. With appropriate care, the risks from infections and anemia can be minimized, improving both the quality and length of life for individuals with sickle cell disease. Chapter 4: Mental and Emotional Struggles. Living with sickle cell disease extends beyond physical symptoms. It deeply affects the mental and emotional well-being of those diagnosed. Chronic illness, recurring pain, hospital visits, and the unpredictability of flare-ups can create an emotional burden that grows over time. Children, adolescents, and adults with sickle cell disease often navigate feelings of frustration, fear, anxiety, and even depression as part of their daily lives. One of the most significant emotional challenges is coping with chronic pain. The pain crises associated with sickle cell disease can be intense, isolating, and exhausting. The anticipation of pain or the trauma of previous episodes can create a constant sense of anxiety. In many cases, people begin to withdraw from social interactions or avoid activities they enjoy for fear that exertion might trigger an episode. Over time, this fear and isolation can lead to depressive symptoms, especially if emotional support is lacking. In children, the emotional toll may be harder to express. They might struggle to understand why they feel unwell so often, or why they can't participate in the same physical activities as their peers. Missing school due to frequent doctor visits or hospital stays can lead to feelings of loneliness and frustration. Academic performance may suffer, not due to lack of ability, but because of the emotional and physical disruptions caused by the disease. Without adequate psychological support, these children may develop low self-esteem or behavioral issues as a response to their circumstances. Teenagers and young adults often face a unique emotional battle as they try to establish their independence. They may feel the burden of managing their health while also trying to fit in socially. The visibility of their condition, such as frequent medical appointments or physical limitations, can make them feel different or misunderstood by others. This emotional disconnect can contribute to social anxiety or withdrawal, and in some cases, a reluctance to adhere to treatment out of a desire to feel normal. Adults living with sickle cell disease often face the added stress of maintaining employment, relationships, and financial stability while managing their health. The emotional weight of planning life around an unpredictable illness can be overwhelming. Feelings of hopelessness, guilt for being a burden, or fear of the future are common, especially during periods of frequent complications. Mental health care is an essential, yet sometimes overlooked aspect of treating sickle cell disease. Access to counseling, peer support groups, and integrated mental health services can make a tremendous difference. Emotional resilience can be strengthened with the right tools, support systems, and understanding, empowering individuals to cope with the psychological challenges of the disease alongside the physical ones. Coping with chronic illness. Coping with chronic illness, especially a lifelong condition like sickle cell disease, presents unique challenges that require constant adaptation and resilience. The physical, emotional, and social demands of managing a condition that doesn't have a cure can be overwhelming. However, with the right strategies and support, individuals with sickle cell disease can navigate daily life more effectively, maintaining a sense of control and well-being. One of the primary aspects of coping is developing a routine that incorporates both medical and self-care practices. Regular checkups, pain management strategies, and preventive treatments such as blood transfusions or vaccinations become central to managing the disease. Establishing a routine not only helps prevent crises, but also creates a sense of normalcy. For many, staying organized, tracking medications, doctor appointments, and symptoms can reduce anxiety and ensure that nothing is overlooked. Learning how to listen to one's body and take breaks when necessary is also a critical part of self-care, as pushing oneself too hard can trigger painful episodes. Mental health is another essential area of focus when coping with chronic illness. Managing the emotional toll of living with sickle cell disease is just as important as addressing the physical aspects. Many individuals benefit from talking to a therapist or counselor who can help them process feelings of anxiety, depression, or frustration that often accompany chronic illness. Cognitive behavioral therapy, CBT, and other therapeutic techniques can teach individuals how to manage negative thoughts and reframe challenges in a more positive light. Support groups, whether in person or online, provide a sense of community and understanding. Sharing experiences with others who understand the realities of sickle cell disease can help combat feelings of isolation. Family and social support play a vital role in coping. Having a strong support system can significantly improve one's ability to manage the emotional and physical demands of sickle cell disease. Family members, close friends, and partners can provide encouragement and help with daily tasks, such as managing medical appointments or assisting during pain crises. Open communication within these support networks is crucial to ensure that individuals with sickle cell disease don't feel alone in their struggles. Additionally, educating loved ones about the disease can improve understanding and empathy, making it easier for them to offer support when needed. Finally, finding ways to stay engaged in life outside of the illness is vital. Pursuing hobbies, interests, or passions can offer a welcome distraction from the day-to-day challenges of sickle cell disease. Maintaining a balance between taking care of oneself and participating in fulfilling activities can contribute to a better quality of life. While chronic illness may always be a part of life for those with sickle cell disease, the right coping mechanisms can help individuals thrive. With proper medical care, emotional support, and personal resilience, people with sickle cell disease can lead rich, meaningful lives despite the ongoing challenges they face. Dealing with anxiety and depression. Living with a chronic illness like sickle cell disease can significantly increase the risk of developing mental health issues such as anxiety and depression. The unpredictable nature of the disease, the physical toll it takes on the body, and the emotional strain from frequent pain crises and hospital visits can all contribute to feelings of sadness, fear, and helplessness. However, understanding these mental health challenges and learning how to address them is essential for improving both emotional and physical well-being. Anxiety often stems from the constant worry about when the next pain crisis or health complication will occur. The fear of hospitalizations, pain episodes, and the long-term effects of the disease can create a constant state of tension and unease. Anxiety can also manifest as difficulty in managing day-to-day activities, as individuals may become preoccupied with their health, fearing that any physical discomfort could signal an impending crisis. The unpredictability of the disease and the emotional toll of never knowing what comes next can result in heightened stress and a lack of control over one's own life. Depression is another common challenge for individuals with sickle cell disease. The repeated physical and emotional pain from the disease, combined with the limitations it imposes on daily life, can lead to a feeling of hopelessness. People with sickle cell disease may feel isolated, especially if they struggle to maintain social connections or participate in activities that they once enjoyed. The chronic nature of the illness can lead to a sense of grieving over the loss of a normal life, and over time, this emotional burden can weigh heavily on one's mental health. One of the most effective ways to cope with anxiety and depression is through therapy and counseling. Cognitive behavioral therapy, CBT, is particularly useful for individuals with chronic illness, as it helps address negative thought patterns and encourages healthier coping strategies. A therapist can guide individuals in recognizing and challenging harmful thoughts and replacing them with more balanced, realistic perspectives. Support groups also provide an important outlet, as they allow individuals to connect with others who truly understand the challenges of living with sickle cell disease. These groups offer shared experiences and can create a sense of community, which is crucial in combating feelings of isolation. Medication is another tool that may be used to help manage anxiety and depression. Antidepressants and anti-anxiety medications, prescribed by a healthcare provider, can help regulate mood and alleviate feelings of distress. These medications are often most effective when combined with therapy and lifestyle changes. In addition to professional support, self-care practices can also make a significant difference in managing anxiety and depression. Engaging in regular physical activity, maintaining a healthy diet, practicing mindfulness or relaxation techniques, and getting enough rest are all important steps toward emotional well-being. Finding ways to stay engaged in hobbies and activities that bring joy can offer a mental break from the challenges of the disease, allowing individuals to focus on things that promote happiness and fulfillment. Managing anxiety and depression as part of sickle cell disease care is essential for overall well-being. Through therapy, medication, support, and self-care, individuals can learn to better navigate the emotional challenges of living with a chronic illness, ultimately improving their quality of life. Building resilience and emotional support systems. For individuals living with sickle cell disease, building resilience and cultivating strong emotional support systems are vital components of maintaining mental and emotional well-being. The unpredictable nature of the disease, coupled with the chronic pain and limitations it can bring, means that having tools to manage stress and a reliable network of supportive relationships can make a significant difference in one's quality of life. Resilience is not about avoiding challenges, but rather about developing the strength to face them with confidence and hope. It begins with a mindset that acknowledges the difficulty of living with a chronic illness, while choosing to focus on what can be controlled. People who build resilience learn to accept their diagnosis while also embracing life fully, setting realistic goals, and celebrating small victories along the way. This positive outlook helps to buffer the emotional lows that can come with pain crises or setbacks in health. One of the most effective ways to build resilience is through self-awareness and emotional regulation. Learning to recognize one's emotions, especially during difficult times, allows for healthier responses rather than reactive ones. Techniques such as mindfulness, journaling, deep breathing exercises, and meditation can help individuals process stress and prevent emotional overwhelm. These practices encourage reflection and calmness, helping to reduce anxiety and promote mental clarity even during flare-ups of the disease. Emotional support systems are equally critical in providing comfort, strength, and motivation. Family members, close friends, caregivers, and even members of healthcare teams form the foundation of a strong support network. Open communication within this circle ensures that those around the individual understand their needs and can offer both practical and emotional assistance. Whether it's providing transportation to appointments, helping manage medications, or simply offering a listening ear, these small acts of support can have a profound impact. Peer support is another invaluable aspect of emotional strength. Connecting with others who are also living with sickle cell disease helps individuals feel understood and less alone in their journey. Support groups, whether in person or online, offer a safe space for sharing stories, advice, and encouragement. Hearing how others cope and thrive can be a powerful motivator and a reminder that it is possible to live a fulfilling life with the condition. Healthcare providers also play a key role in fostering emotional support. A compassionate, informed medical team that acknowledges both the physical and emotional aspects of the disease can offer tailored care that addresses the whole person, not just the symptoms. Ultimately, building resilience and support systems takes time and intentional effort, but the results are long-lasting. A strong emotional foundation empowers individuals to navigate life's challenges with greater strength, hope, and peace, even in the face of a lifelong condition like sickle cell disease. Chapter 5: Treatment and Management Options. Effective treatment and management of sickle cell disease focus on reducing symptoms, preventing complications, and improving the overall quality of life. While there is currently no universal cure for the disease, advancements in medical care have provided patients with a range of options to manage their condition more effectively. A personalized approach to treatment, based on the individual's symptoms, age, health status, and lifestyle, is essential for optimal outcomes. One of the most widely used treatments for sickle cell disease is hydroxyurea. This medication helps reduce the frequency of pain crises and the need for blood transfusions by increasing the production of fetal hemoglobin. Fetal hemoglobin is a type of hemoglobin that prevents red blood cells from sickling. By improving the flexibility and lifespan of red blood cells, hydroxyurea helps alleviate some of the disease's most painful and dangerous symptoms. However, like any medication, it must be carefully monitored by healthcare providers to manage side effects and ensure it remains effective over time. Blood transfusions are another common treatment, particularly during severe complications such as stroke or acute chest syndrome. Regular transfusions can help reduce the risk of these life-threatening events by increasing the number of healthy red blood cells in circulation. However, frequent transfusions come with risks, such as iron overload, which must be managed with chelation therapy to remove excess iron from the body. Bone marrow or stem cell transplantation offers the closest possibility of a cure. This procedure replaces the patient's bone marrow with that of a healthy donor, ideally a matched sibling. While promising, this treatment is not widely accessible due to the difficulty of finding compatible donors and the potential risks associated with the procedure. Nonetheless, for some patients, especially children, it has led to long-term remission of the disease. Supportive care is just as important as medical interventions. Pain management strategies, including the use of medications, heating pads, hydration, and physical therapy, help individuals manage daily symptoms and improve comfort. Preventive care, such as routine vaccinations and antibiotics, reduces the risk of infections, which can be especially dangerous for people with sickle cell disease. Nutrition, hydration, and regular exercise, tailored to the individual's condition, also play a vital role in management. Avoiding stress and extreme temperatures, getting plenty of rest, and maintaining a consistent healthcare routine contribute to fewer complications and better overall health. Ongoing research continues to explore gene therapies and new medications that target the underlying cause of the disease. With continued medical advancements and comprehensive management plans, individuals with sickle cell disease are living longer, more fulfilling lives than ever before. Medications and pain management. Managing pain is one of the most critical components of treating sickle cell disease. Pain episodes, also known as sickle cell crises, are caused by the blockage of blood flow when sickled red blood cells clump together in blood vessels. These episodes can vary in intensity and duration, often requiring a combination of medications and coping strategies to manage effectively. A well-structured pain management plan, tailored to the individual's needs, can significantly improve comfort and reduce hospitalizations. Over-the-counter pain relievers like acetaminophen and ibuprofen are often used to treat mild to moderate pain at home. These medications can be effective when used early in a crisis or for less severe discomfort. However, for more intense pain, prescription medications, including opioids, may be necessary. Drugs like morphine, hydromorphone, or oxycodone are commonly prescribed for severe crises and must be carefully monitored by healthcare providers to avoid dependency while ensuring adequate pain relief. In addition to direct pain control, certain medications help reduce the frequency and severity of crises. Hydroxyurea is a cornerstone of sickle cell treatment. It works by increasing fetal hemoglobin levels, which reduces the likelihood of red blood cells sickling. As a result, patients on hydroxyurea often experience fewer pain episodes and need fewer hospital visits. However, it requires regular monitoring through blood tests to ensure proper dosage and safety. Another medication, L-glutamine, is approved for reducing complications of sickle cell disease. It helps decrease oxidative stress in red blood cells, thereby reducing the number of pain crises. Additionally, voxelotor and crizanlizumab are newer drugs designed to address specific mechanisms of the disease. Voxelotor improves hemoglobin's oxygen-carrying ability and reduces hemolysis, while crizanlizumab targets inflammation and adhesion of sickled cells to blood vessels, which helps prevent vaso-occlusion. Non-pharmacological pain management techniques also play a vital role in overall treatment. These may include warm baths, heating pads, massage therapy, relaxation techniques, and physical therapy. Staying well hydrated and avoiding known pain triggers, such as cold temperatures, stress, and dehydration, are equally important. Patients are often encouraged to keep a pain diary to track patterns, triggers, and the effectiveness of treatments, which helps healthcare providers adjust management plans accordingly. An integrated approach that combines medication with lifestyle adjustments and emotional support provides the most effective pathway for managing sickle cell pain. With advances in medication and a better understanding of pain pathways, individuals with sickle cell disease are increasingly empowered to manage their pain and live with greater comfort and stability. Blood transfusions and bone marrow transplants. Blood transfusions and bone marrow transplants are two vital medical interventions in the treatment and management of sickle cell disease. While they serve different purposes and are used under different circumstances, both approaches aim to improve the patient's quality of life and, in some cases, offer the potential for long-term relief or even a cure. Blood transfusions are a common and often life-saving treatment for individuals with sickle cell disease. During a transfusion, healthy red blood cells from a donor are introduced into the patient's bloodstream. These normal cells help carry oxygen more effectively and dilute the number of sickled cells, reducing the risk of complications such as stroke, acute chest syndrome, and severe anemia. There are different types of transfusions, including simple transfusions and exchange transfusions. Simple transfusions involve adding healthy blood to the patient's system, while exchange transfusions remove some of the patient's sickled blood and replace it with donor blood. The latter is especially effective in reducing complications and is often used in emergency settings. Regular transfusion therapy is sometimes recommended for children with a high risk of stroke, as identified by transcranial Doppler (TCD) ultrasound screenings. By maintaining a lower percentage of sickled cells, regular transfusions can significantly reduce the likelihood of a first stroke and are also used as part of post-stroke care. However, repeated transfusions can lead to iron overload, a condition in which excess iron builds up in the body. To prevent damage to organs, patients undergoing frequent transfusions may need iron chelation therapy, which involves medication to remove the extra iron. Bone marrow or stem cell transplants offer a more definitive treatment option and are currently the only known potential cure for sickle cell disease. This procedure involves replacing the patient's bone marrow, which produces sickled red blood cells, with healthy marrow from a compatible donor, usually a sibling. The new marrow then begins producing normal red blood cells. While the results can be transformative, not everyone is eligible for this treatment. It requires a perfect or near-perfect donor match, and the procedure itself carries risks, including rejection and infections due to the suppression of the immune system. Because of the complexity and risks involved, bone marrow transplants are typically recommended for patients with severe complications who have not responded well to other treatments. However, ongoing research and advancements in transplant techniques are expanding eligibility and improving success rates. These innovations are offering hope to more individuals and families affected by sickle cell disease. Both blood transfusions and bone marrow transplants have reshaped the landscape of sickle cell treatment. While not without their challenges, they represent powerful tools in the journey toward better health, fewer complications, and for some, a life free from the burden of sickle cell disease. Advances in gene therapy. Gene therapy represents one of the most exciting and promising frontiers in the treatment of sickle cell disease. Unlike traditional approaches that focus on managing symptoms or complications, gene therapy aims to correct the underlying genetic defect that causes the disease. With continued research and clinical trials, gene therapy is moving closer to becoming a viable cure for many individuals living with this lifelong condition. Sickle cell disease is caused by a mutation in the gene that codes for hemoglobin, the protein in red blood cells responsible for carrying oxygen throughout the body. This mutation results in the production of hemoglobin S, which causes red blood cells to become rigid and sickle-shaped. These abnormally shaped cells tend to block blood flow and break down more quickly, leading to pain, anemia, and a host of complications. Gene therapy seeks to either repair this faulty gene or introduce a new one that allows the body to produce healthy hemoglobin. One of the leading strategies involves using a modified virus to deliver a functional copy of the hemoglobin gene into the patient's own stem cells. These stem cells are extracted, genetically modified in the lab, and then reintroduced into the patient's body after chemotherapy has cleared out the existing bone marrow. Once in place, the modified cells begin producing normal hemoglobin, gradually replacing the diseased cells with healthy ones. This approach has already shown remarkable success in early clinical trials, with some patients experiencing a complete absence of sickle cell crises after treatment. Another groundbreaking technique is gene editing, particularly using CRISPR-Cas9 technology. Rather than introducing a new gene, CRISPR allows scientists to precisely target and correct the mutation in the patient's DNA. Some therapies using this method also reactivate the production of fetal hemoglobin, a type of hemoglobin naturally present at birth that is not affected by the sickle mutation. Fetal hemoglobin can take over the role of the defective adult form, greatly reducing or even eliminating symptoms of the disease. Though gene therapy is still in its developmental stages, it holds immense potential. The primary challenges include the high cost, limited access to specialized treatment centers, and the need for long-term safety data. Nevertheless, as technology advances and more people participate in clinical trials, it is expected that gene therapy will become more widely available and accessible. For individuals living with sickle cell disease, gene therapy offers hope, not just for better symptom management, but for a future free from the disease itself. As research progresses, this innovative treatment is likely to transform the standard of care and redefine what is possible for those affected by this challenging condition. Chapter 6: Nutrition and Lifestyle Choices. For individuals living with sickle cell disease, making mindful nutrition and lifestyle choices can have a profound impact on managing symptoms, reducing complications, and improving overall health and well-being. While medical treatments are essential, everyday habits play a critical role in supporting the body's ability to function more efficiently and cope with the challenges of the condition. A well-balanced diet is essential for people with sickle cell disease. Due to the increased breakdown of red blood cells, individuals with the condition often require more nutrients than the average person. Iron is typically not needed in high amounts, especially for those receiving regular blood transfusions, as excess iron can build up in the body. However, other nutrients such as folic acid, vitamin B12, and vitamin C are crucial because they support the production of healthy red blood cells. Leafy green vegetables, citrus fruits, lean meats, legumes, and fortified grains can help supply these important vitamins and minerals. Staying hydrated is also a top priority. Proper hydration keeps the blood thinner and helps prevent red blood cells from sickling and sticking to vessel walls, which can trigger painful crises. Physical activity should be approached with care. While regular, moderate exercise can improve circulation, boost energy levels, and enhance overall fitness, individuals must avoid overexertion and extreme temperatures, which can trigger a sickle cell crisis. Activities like walking, swimming, yoga, and light aerobic exercises are generally safe and beneficial when done under the guidance of healthcare providers. Rest and recovery are just as vital, as fatigue is a common symptom, and the body needs time to recover from the daily strain caused by sickle cell disease. Avoiding known triggers is also a key aspect of lifestyle management. Stress, dehydration, exposure to cold or extreme heat, and high altitudes are all potential factors that can lead to a crisis. Creating a routine that includes proper rest, stress-reducing techniques like meditation or breathing exercises, and awareness of environmental risks can help individuals stay stable and reduce hospital visits. Additionally, avoiding smoking, limiting alcohol intake, and staying up to date on vaccinations can reduce the risk of infections and further complications. Support from family, community groups, and healthcare professionals also contributes to emotional well-being and resilience. Incorporating these nutrition and lifestyle strategies can empower individuals with sickle cell disease to take an active role in their care. By reinforcing the body's natural defenses and minimizing avoidable risks, these choices complement medical treatments and lead to a more balanced, healthier life. The role of diet in managing symptoms. Diet plays a crucial role in helping individuals with sickle cell disease manage symptoms and maintain overall health. While there is no specific sickle cell diet, certain nutritional strategies can help reduce the frequency of pain crises, combat fatigue, support immune function, and improve the body's ability to produce healthy red blood cells. Eating the right combination of foods can strengthen the body's resilience and lessen the impact of the disease on daily life. One of the most important dietary needs for individuals with sickle cell disease is maintaining proper hydration. Dehydration can cause red blood cells to sickle more easily, leading to blockages and pain episodes. Drinking plenty of water throughout the day helps maintain smooth blood flow and reduces the likelihood of crises. Including water-rich fruits and vegetables like cucumbers, melons, and oranges can also contribute to hydration levels. A diet rich in essential vitamins and minerals supports red blood cell production and helps the body cope with the ongoing stress of the disease. Folic acid in particular is vital because it aids in the creation of new red blood cells, which the body needs to replace more frequently due to the shortened lifespan of sickled cells. Foods high in folic acid include dark leafy greens, beans, peas, and fortified cereals. Vitamin B12 and iron are also necessary for red blood cell development, though iron intake should be monitored closely in individuals receiving regular blood transfusions to avoid iron overload. Antioxidants, such as vitamin C and vitamin E, help protect the body's cells from damage caused by inflammation and oxidative stress, both of which are common in sickle cell disease. Citrus fruits, berries, nuts, seeds, and colorful vegetables are excellent sources of these nutrients. Zinc and magnesium are minerals that play roles in immune health and muscle function, and can be found in foods like whole grains, legumes, lean meats, and dairy products. Protein is another key component of the diet, as it supports tissue repair and growth. Including lean protein sources such as fish, chicken, eggs, tofu, and legumes helps meet the body's increased demands. Omega-3 fatty acids, found in fatty fish like salmon and in flax seeds and walnuts, have anti-inflammatory properties and may help reduce the frequency of pain crises. Ultimately, a nutrient-rich, balanced diet tailored to individual needs can greatly enhance quality of life for people with sickle cell disease. Consulting with a registered dietitian familiar with the condition can provide personalized guidance and ensure nutritional goals are met safely and effectively. Staying active while avoiding overexertion. For individuals with sickle cell disease, staying physically active can promote better circulation, improve mood, and support overall health. However, because the disease affects oxygen delivery and can trigger pain crises under stress, it's essential to strike a balance between activity and rest. Engaging in appropriate physical movement without overexertion is key to maintaining wellness and avoiding complications. Exercise should be approached thoughtfully, with awareness of how the body responds to physical stress. Activities that are low impact and allow for gradual intensity increases are generally recommended. Walking, swimming, stretching, yoga, and light aerobic exercises are excellent options for maintaining mobility and cardiovascular health. These types of exercise improve circulation without placing excessive demands on the heart and muscles, which is especially important for those prone to fatigue and joint pain. Hydration before, during, and after exercise is critical. Dehydration can cause red blood cells to sickle more easily, potentially leading to a crisis. Drinking water regularly and avoiding exercise in extremely hot or cold environments can help prevent unnecessary stress on the body. Wearing breathable clothing and taking breaks during activity can also reduce the risk of overheating or exhaustion. Listening to the body is one of the most important strategies for staying safe while active. Signs of fatigue, dizziness, unusual shortness of breath, or pain should not be ignored. Rather than pushing through discomfort, individuals with sickle cell disease are encouraged to pause and rest as needed. Overexertion can increase the likelihood of complications and lead to setbacks in recovery, so pacing is essential. Involving healthcare providers in the development of a fitness routine ensures that activity levels are appropriate. Physical therapists or exercise specialists who understand the condition can tailor programs to meet individual needs and goals. Children and adolescents with sickle cell disease can especially benefit from structured and supervised activity to support healthy growth and development. Equally important is building a routine that includes both movement and recovery. Incorporating rest days, stress-reducing practices such as deep breathing or meditation, and maintaining a consistent sleep schedule all contribute to a balanced lifestyle. These habits support the body's ability to heal and manage daily stressors, which can minimize the frequency and severity of sickle cell-related symptoms. Staying active with sickle cell disease is not only possible, it can be a powerful tool for better health. With the right approach, individuals can enjoy the benefits of movement while protecting themselves from overexertion and potential health crises. Importance of hydration and rest. Hydration and rest are two of the most critical components of daily life for individuals living with sickle cell disease. They play a central role in managing symptoms, preventing complications, and maintaining overall well-being. While they may seem like simple lifestyle factors, their impact on the functioning of the body, especially in the context of a chronic condition like sickle cell disease, is profound and often underestimated. Adequate hydration helps prevent the sickling of red blood cells. When the body is dehydrated, blood becomes thicker and moves more slowly through the blood vessels, increasing the likelihood that sickle-shaped cells will clump together and block blood flow. These blockages lead to painful episodes known as sickle cell crises. Drinking plenty of fluids helps keep the blood diluted and flowing smoothly, which significantly reduces the risk of these painful blockages. Water is the best source of hydration, but other fluids such as herbal teas, diluted fruit juices, and soups can also contribute. It is especially important to stay hydrated during hot weather, physical activity, illness, or times of stress, when the body tends to lose more fluids than usual. Rest is equally important. The constant turnover of red blood cells in individuals with sickle cell disease means their bodies are often working harder than normal to maintain adequate oxygen levels and energy. Fatigue is a common symptom, and without sufficient rest, the body becomes more vulnerable to pain episodes, infections, and other complications. Quality sleep allows the body to repair and recover, helping it better cope with the ongoing demands of the disease. A consistent sleep schedule, a comfortable sleep environment, and healthy sleep habits can go a long way in improving rest quality. Short naps during the day can also be beneficial, especially during periods of increased fatigue or illness. It's important to balance activity with recovery and not feel pressured to push through tiredness. For children and adolescents, proper rest is vital for growth and development, and caregivers should prioritize their sleep needs just as much as their medical treatments. Together, hydration and rest support the body's resilience and strengthen its ability to manage the challenges posed by sickle cell disease. They serve as foundational elements of self-care and complement medical interventions by reducing the frequency and intensity of symptoms. When consistently prioritized, these simple yet powerful habits can lead to a noticeable improvement in daily comfort and long-term health outcomes. Chapter 7: Navigating Healthcare and Support Systems. Living with sickle cell disease requires ongoing interaction with the healthcare system, making it essential for individuals and families to understand how to effectively navigate medical care and tap into support resources. Access to knowledgeable healthcare providers, timely treatments, and emotional and community support can make a significant difference in both day-to-day management and long-term outcomes. However, challenges such as limited specialist availability, healthcare disparities, and complex medical routines can make this journey difficult without proper guidance. A key aspect of navigating healthcare is building a strong relationship with a multidisciplinary team that understands sickle cell disease. This often includes a hematologist, primary care physician, pain management specialists, mental health professionals, and nurses who work together to create and maintain an individualized care plan. Consistent communication with the care team ensures that changes in symptoms or lifestyle can be addressed quickly, preventing complications and improving quality of life. It also allows for regular monitoring through lab tests, imaging, and physical exams to catch issues early. Patients and caregivers must also become advocates for their health. This means keeping detailed medical records, understanding treatment options, and asking questions when something is unclear. In emergency situations, it helps to carry documentation that outlines the individual's diagnosis, typical pain management protocol, and known complications. Many hospitals are not fully equipped or experienced in treating sickle cell crises, so having this information readily available can speed up care and ensure it aligns with best practices. Support systems extend beyond medical care. Social workers, case managers, and patient advocacy groups can provide assistance with navigating insurance, scheduling appointments, finding transportation to clinics, or accessing financial aid programs. These services reduce the burden on families and help ensure that care remains consistent and affordable. Community organizations and support groups offer emotional support and education, connecting individuals with others who share similar experiences. Education is also crucial in navigating healthcare effectively. Patients and families benefit from learning about the disease, current treatments, and self-management strategies. Attending workshops, reading materials from trusted sources, and joining online forums can help deepen understanding and confidence in managing the condition. Ultimately, successfully navigating healthcare and support systems requires a combination of knowledge, preparation, and the willingness to seek help when needed. Empowered patients and families who understand how to access and utilize available resources are better positioned to face the challenges of sickle cell disease with resilience and hope. Accessing quality medical care. Accessing quality medical care is crucial for individuals living with sickle cell disease, as the condition requires ongoing management and specialized treatment. Securing the right care ensures that individuals can prevent complications, manage pain effectively, and receive appropriate interventions when crises occur. However, navigating the healthcare system can be challenging, and people with sickle cell disease often face barriers such as limited access to specialists, lack of awareness among healthcare providers, and financial constraints. The first step in accessing quality care is finding a healthcare team with expertise in sickle cell disease. Ideally, this includes a hematologist who specializes in blood disorders and a team of support professionals such as nurses, pain management specialists, and mental health counselors. Comprehensive care is important because sickle cell disease affects multiple organ systems, and managing the disease requires a holistic approach. It's essential for individuals to have a primary care provider who understands the complexities of sickle cell disease and can coordinate care with specialists to ensure that all aspects of the disease are addressed. Patients should also seek out hospitals or clinics that are well equipped to manage sickle cell crises and long-term care. These medical centers often have dedicated sickle cell programs, which are designed to provide specialized treatments and consistent care for individuals with the disease. These facilities are also more likely to be familiar with the latest research, therapies, and best practices for managing the condition. When considering where to receive care, it's important to inquire about the availability of these resources and whether the facility has a track record of treating sickle cell disease effectively. Another important aspect of accessing quality care is ensuring that individuals and their families are informed and proactive about their healthcare needs. This means keeping track of medical history, staying up to date on treatments, and asking questions during doctor visits. It's also vital to communicate openly with healthcare providers about symptoms, pain levels, and other concerns. Being an advocate for one's own health can help ensure that appropriate treatments are prescribed and that the care team is responsive to individual needs. Navigating insurance can also be a significant part of accessing care, as treatments for sickle cell disease can be costly. Families may need to work with case managers or social workers to understand insurance coverage, apply for financial assistance, or explore other resources that can help cover medical expenses. In many cases, patient advocacy organizations can provide additional support and resources to help individuals access the care they need. In summary, accessing quality medical care requires individuals with sickle cell disease to be informed, proactive, and persistent in seeking the right providers, hospitals, and resources. With the right care team and support, people with sickle cell disease can better manage their condition and improve their overall health outcomes. Support groups and community resources. Support groups and community resources play an essential role in the lives of individuals with sickle cell disease. Living with a chronic illness can be physically and emotionally exhausting, and having a support system in place is critical to maintaining mental health, navigating healthcare challenges, and gaining a sense of solidarity. Support groups, whether in person or online, offer individuals the opportunity to connect with others who understand their experiences, share advice, and provide mutual encouragement. Support groups provide an invaluable space where individuals can talk openly about their challenges, frustrations, and victories. This sense of community is especially important for people with sickle cell disease, as it can be difficult to find others who truly understand the complexities of living with the condition. Sharing personal stories helps individuals cope with feelings of isolation and builds a sense of empowerment and shared purpose. Furthermore, these groups often offer educational resources about the disease, new treatment options, and coping strategies that can improve the quality of life for members. In addition to peer support, many sickle cell support groups are associated with organizations that offer professional resources and services. These organizations may provide educational materials, facilitate workshops, and advocate for better healthcare policies and access to treatments. National organizations such as the Sickle Cell Disease Association of America, SCDAA, and local nonprofit groups work tirelessly to raise awareness, conduct research, and provide information about sickle cell disease management. They can also help connect individuals to healthcare providers, assist with finding financial aid, and provide resources for families, caregivers, and children affected by sickle cell disease. Community-based resources are also critical for those living with sickle cell disease. These can include local health centers, social services, and financial assistance programs. Many communities offer transportation assistance to help individuals get to medical appointments, or provide meal programs for those who need nutritional support. Social workers or case managers within these organizations can help guide individuals through the complex process of accessing care, understanding insurance, and finding resources for day-to-day support. Engaging in these community resources helps reduce the burden of living with sickle cell disease. It allows individuals and families to connect with a broader network of people and services that can help manage both the physical and emotional toll of the disease. Whether it's a formal support group, an advocacy organization, or local community services, these resources provide critical emotional support and practical assistance that can make a significant difference in the lives of those affected by sickle cell disease. Insurance and financial assistance. For individuals with sickle cell disease, managing healthcare expenses can be one of the most significant challenges. Medical treatments, hospitalizations, medications, and regular doctor visits can be costly, even with insurance coverage. Given the chronic nature of the disease, ongoing expenses are a reality for most individuals and their families, making it crucial to explore all available insurance options and financial assistance programs to ease this burden. Insurance coverage is the first line of defense in managing healthcare costs. Many individuals with sickle cell disease rely on health insurance plans, which can come through employers, government programs like Medicaid or Medicare, or private insurance. It's important to carefully review the details of the insurance policy, particularly coverage for specialized care, emergency services, medications, and hospital stays. Some plans may cover treatments like blood transfusions, pain management therapies, and newer treatments like gene therapy, while others may not. Families must be proactive in understanding the scope of their coverage, including out-of-pocket costs, co-pays, and whether preferred sickle cell specialists are included in the network. For those without comprehensive insurance, or for those struggling with high out-of-pocket costs, financial assistance programs can provide vital support. Nonprofit organizations, such as the Sickle Cell Disease Association of America, SCDAA, often have information on financial aid opportunities, including grants, scholarships, and other resources for individuals with sickle cell disease. These organizations may also help connect individuals with pharmaceutical assistance programs that provide free or discounted medications. Additionally, many hospitals and healthcare facilities offer financial assistance programs for patients who have difficulty affording care. Social workers and case managers can help families apply for these programs, which may cover medical bills, transportation costs, or even provide assistance with housing and meals during long hospital stays. In some cases, hospitals will work with patients to develop payment plans or negotiate costs, helping ease the financial stress associated with chronic illness. For individuals with sickle cell disease, it's also beneficial to explore public assistance programs that may be available at the local, state, or federal level. Programs like Supplemental Security Income, SSI, or Social Security Disability Insurance, SSDI, may provide income support for those unable to work due to the severity of their condition. Eligibility for these programs is determined by medical evidence and financial need, so it's important to work with healthcare providers and legal advisors to ensure all required documentation is submitted accurately. In summary, navigating insurance and financial assistance is crucial for managing the costs associated with sickle cell disease. By understanding insurance options, leveraging financial aid programs, and seeking support from community resources, individuals and families can significantly reduce the financial burden of living with the disease and focus more on managing health and well-being. Chapter 8: Living a Full Life with Sickle Cell. Living a full life with sickle cell disease may seem daunting, but with the right mindset, medical care, and support, individuals can thrive and experience joy, success, and fulfillment. While the disease presents significant challenges, it is important to recognize that it does not define a person's potential. Many individuals with sickle cell disease lead successful careers, engage in meaningful relationships, and pursue hobbies and interests, all while managing their health. The key to living a full life lies in self-care, resilience, and the ability to seek support when needed. One of the most important aspects of living well with sickle cell disease is effective self-management. This includes staying on top of regular medical appointments, adhering to prescribed treatments, and being proactive in managing symptoms. For many individuals, this also means closely monitoring triggers like dehydration, infection, or extreme temperatures that could lead to crises. Being mindful of one's physical limitations while also pushing for personal growth is essential in maintaining both physical and emotional well-being. Maintaining a healthy lifestyle is another crucial component. A balanced diet, regular hydration, and staying active within one's capacity can help mitigate symptoms and prevent complications. While overexertion should be avoided, gentle activities like walking, swimming, or yoga can help maintain strength and flexibility. Engaging in exercise, even on a limited basis, can improve circulation, reduce stress, and enhance overall mood. Taking care of one's body helps increase energy levels and provides a sense of empowerment. A vital part of living a full life is also building and nurturing a support network. Family, friends, healthcare providers, and support groups can provide emotional encouragement and practical help, especially during tough times. Having people who understand the realities of living with sickle cell disease can make a world of difference in reducing feelings of isolation. Moreover, connecting with others in the sickle cell community fosters a sense of camaraderie and shared experience, offering inspiration and strength. In addition to healthcare and support systems, pursuing personal passions and goals is critical to living a rich life. Whether it is advancing in a career, continuing education, engaging in creative endeavors, or traveling, these aspirations provide purpose and joy. While sickle cell disease can present physical barriers, many individuals find ways to work around these challenges and continue to achieve their dreams. Ultimately, living a full life with sickle cell disease involves embracing one's identity and capabilities. It means acknowledging the struggles, but also celebrating resilience, perseverance, and the strength to thrive despite obstacles. By adopting a positive outlook, taking proactive steps in self-care, and cultivating a strong support network, individuals with sickle cell disease can enjoy life to the fullest. Education and career planning. Education and career planning are essential aspects of living a fulfilling life with sickle cell disease. While the challenges associated with the condition can sometimes seem overwhelming, many individuals with sickle cell disease pursue higher education, develop meaningful careers, and make important contributions to society. With thoughtful planning, self-awareness, and support, it is possible to balance educational and professional goals with the needs of one's health. When it comes to education, early preparation is key. Students with sickle cell disease may need to make accommodations to ensure they can manage their condition while pursuing their studies. For example, they may need extra time for assignments, the ability to take breaks during exams, or access to rest periods during long hours of study. It's important for students to communicate with their teachers, school administrators, and academic counselors about their needs. In some cases, special education services or a 504 plan may be available to help support students with chronic health conditions, allowing them to have a more flexible academic schedule and access to additional resources. In addition to academic accommodations, managing sickle cell disease while pursuing education requires careful attention to physical health. Students should make sure to maintain a consistent routine that includes healthy eating, staying hydrated, getting enough rest, and avoiding overexertion. These efforts can help minimize symptoms and prevent crises, which might otherwise interrupt their studies. It's also important to learn how to balance academic work with self-care routines and personal time, as stress and fatigue can exacerbate symptoms. When transitioning from education to a career, individuals with sickle cell disease should consider a range of factors. Choosing a career that offers flexibility, a manageable work schedule, and an understanding work environment can greatly impact long-term success and well-being. For example, individuals may prefer careers that allow for remote work or flexible hours, which can help accommodate healthcare appointments and the need for rest during flare-ups. It is essential to research different career paths and consider one's interests and skills while also acknowledging the physical demands of the job. Workplace accommodations are also important in career planning. Under the Americans with Disabilities Act, ADA, employees with chronic health conditions like sickle cell disease are entitled to reasonable accommodations such as modified schedules, the ability to take breaks, or ergonomic adjustments to the workspace. Individuals should be aware of their rights in the workplace and seek support from human resources if accommodations are needed. Ultimately, education and career planning with sickle cell disease requires a holistic approach, taking into consideration both professional aspirations and health management. By building a support network, advocating for necessary accommodations, and maintaining a focus on self-care, individuals with sickle cell disease can achieve their academic and career goals while managing their health. Relationships and family life. Living with sickle cell disease can have a significant impact on relationships and family life. The physical and emotional challenges that come with the condition can sometimes strain relationships, but they also present opportunities for growth, understanding, and resilience. Open communication, mutual support, and shared coping strategies are key to maintaining strong connections with loved ones while managing the complexities of sickle cell disease. For individuals with sickle cell disease, one of the most important aspects of relationships is being able to openly communicate their needs. This might include explaining how their symptoms affect daily activities, the importance of rest, or the need for flexibility in plans due to health concerns. It's important for partners, family members, and friends to understand that while individuals with sickle cell disease may face physical limitations, their emotional and mental well-being is just as important. Being able to express one's feelings and challenges can reduce misunderstandings and foster deeper empathy. In romantic relationships, sickle cell disease may require partners to navigate challenges related to physical intimacy, caregiving, and emotional support. It's essential for both individuals in the relationship to be honest about their needs and limitations, as well as to find ways to connect emotionally and physically despite the obstacles. For couples, maintaining a balance between caregiving responsibilities and ensuring that both individuals feel valued and supported is crucial. This may require flexibility, as well as mutual understanding that there will be both good days and bad days. Prioritizing time together, seeking counseling if needed, and practicing self-care can help strengthen the relationship despite the challenges. Family life also requires adaptation when dealing with a chronic illness like sickle cell disease. For parents, the diagnosis of sickle cell disease in a child can be overwhelming. It is important for families to work together to manage the health needs of the child, while also nurturing the emotional and developmental needs of all family members. Sibling relationships can be impacted as well, as siblings may need to understand the demands of living with sickle cell disease and learn how to provide support without feeling neglected or overwhelmed. For extended families, it's important to foster an environment of understanding and encouragement. Open discussions about sickle cell disease can help demystify the condition and reduce feelings of isolation for both the individual with the disease and their family members. Having a supportive family environment can also provide individuals with sickle cell disease a sense of stability and emotional strength, enabling them to cope better with the challenges of living with the condition. Ultimately, the key to maintaining healthy relationships and a fulfilling family life while managing sickle cell disease is open communication, mutual respect, and a commitment to supporting each other through the ups and downs. By understanding the realities of the condition and working together, families can build stronger bonds and navigate the complexities of life with sickle cell disease. Advocacy and raising awareness. Advocacy and raising awareness are essential components in improving the lives of individuals living with sickle cell disease. While the medical community has made strides in research and treatment, much work remains to be done in terms of public education, policy reform, and access to care. By increasing awareness and advocating for the needs of those affected by sickle cell disease, individuals and communities can work toward creating a more supportive and informed environment for those living with the condition. One of the most powerful tools in advocacy is education. Many people still have limited knowledge about sickle cell disease, often leading to misconceptions and stigma. Raising awareness helps to educate the public about the true nature of the disease, its symptoms, and the challenges that individuals with sickle cell disease face. Awareness campaigns can be run through social media, schools, healthcare organizations, and public events. These campaigns aim to inform the broader community, encourage empathy, and increase understanding. Additionally, awareness campaigns can empower individuals living with sickle cell disease to take an active role in educating others about their condition, helping to reduce the isolation and stigma they may experience. Advocacy also plays a critical role in policy and legislative efforts. Individuals with sickle cell disease and their families often face challenges in accessing adequate healthcare, insurance coverage, and treatments. Through advocacy, it is possible to push for changes in policies that can improve the lives of those affected. This can include advocating for increased funding for research, better access to pain management, improved healthcare insurance options, and more comprehensive care for people living with sickle cell disease. Supporters of sickle cell advocacy can join national and local organizations, such as the Sickle Cell Disease Association of America, which work to push for legislative changes and raise awareness about the condition. In addition to healthcare-related advocacy, it is important to support and encourage people with sickle cell disease to become advocates for their own care. Empowering individuals to be proactive in their healthcare decisions, understand their rights, and speak up about their needs is essential. This empowerment can help individuals navigate the complex healthcare system, access necessary treatments, and ensure they receive the best possible care. Building a strong, unified voice within the sickle cell community also plays a significant role in advocacy efforts. When individuals, families, healthcare providers, and advocacy organizations work together, they can have a greater impact on improving policies, increasing funding for research, and providing better services to those affected by sickle cell disease. By raising awareness and advocating for change, we can create a world where individuals with sickle cell disease are better understood, better supported, and have access to the care they deserve. Ultimately, advocacy and raising awareness are about creating lasting change. By shedding light on the challenges faced by individuals with sickle cell disease, we not only improve the lives of those affected, but also foster a more inclusive, compassionate society. Conclusion. Living with sickle cell disease presents numerous challenges, both physical and emotional. However, through early diagnosis, proper management, and ongoing advocacy, individuals with sickle cell can lead fulfilling lives. The disease may bring about pain crises, organ damage, and mental health struggles, but with a strong support system, proper healthcare, and a proactive approach to managing symptoms, those affected can thrive despite the hurdles they face. Understanding sickle cell disease, its genetic origins, its impact on the body, and its long-term effects, is fundamental to not only managing the condition, but also in fostering empathy and support in communities. Through education and awareness, misconceptions and stigma surrounding the disease can be diminished, allowing for greater social inclusion and better healthcare outcomes. Treatment options for sickle cell disease are continually evolving, with advancements in gene therapy and stem cell treatments offering hope for a future where the disease might be cured or more effectively managed. Medications, blood transfusions, bone marrow transplants, and pain management remain crucial in alleviating symptoms and preventing complications. As medical science advances, the outlook for individuals living with sickle cell disease continues to improve, making early intervention and research more important than ever. Beyond medical treatment, lifestyle choices such as proper nutrition, regular hydration, and managing physical activity play significant roles in symptom management. Patients, families, and healthcare providers all have a part in ensuring that those with sickle cell disease can live as healthy and fulfilling a life as possible. Relationships, career planning, and access to community resources are also essential elements in supporting individuals with the condition. Advocacy is a powerful tool in the fight for better care, awareness, and support. By raising awareness about sickle cell disease, individuals and organizations can make a real difference in policies, healthcare access, and social inclusion. Through collective efforts, a world that better understands and supports those living with sickle cell disease can become a reality. In conclusion, while sickle cell disease may remain a lifelong challenge, it is possible to live with it and even thrive. With advancements in healthcare, strong emotional and community support, and continued advocacy for awareness and change, individuals with sickle cell disease can live full, meaningful lives. The journey may be difficult, but it is not one to be faced alone. Together, we can work toward a brighter future for all those affected by this condition.